Good morning, everybody, or good afternoon, rather, everybody. And I want to welcome all of you to City Hall, and I want to welcome you all to this joint committee on an issue that is so deeply important to us in the city, us in City Council, and one that we're working hard in collaboration with everyone who came out today about shining a light on the issue of youth homelessness and youth who are experiencing homelessness in our city. This hearing is now called to order. This is a public hearing of the Joint City Council Committees on Children and Youth and Housing, Neighborhood Development, and the Homeless. The purpose of this public hearing is to hear testimony on resolution number 160235. I'd like to recognize my colleague and co-chair of the Committee on Housing, Neighborhood Development, and the Homeless, Councilman Alan Dom. Councilman Dom, would you like to have any opening remarks?
Thank you, Madam Chairwoman. It's the first time we're together like this. It's pretty cool, huh? But this is a very important issue, and I'm glad to see everybody's here. We're going to get started, so not to waste your time. We value your time. So we're concerned about this issue. It's just amazing to me that this issue exists. I don't understand why it exists and why we're not dealing with it, because it's terrible to have homelessness. It's worse to have young people homeless. It's just something it's hard to fathom. So we want to hear all these issues, try to figure out some solutions, and try to hopefully end it. So thank you for your participation today. I'll turn it back to you.
Thank you very much, Councilman. I'd like to also add my gratitude to everybody who came out here today. So often when issues aren't brought to light, it's in part because people don't understand the faces behind it. We have a lot of statistics on poverty in Philadelphia and deep poverty in particular. We know that 39% of our young people in our city suffer from poverty. But we've often said that poverty can't just be relegated to a bunch of statistics and numbers. It's actually a very lived experience. And how people experience poverty in our city is important for us to not just see through numbers, but through the actual things that we have to do and think about as legislators, as a city, to raise moral attention to issues that deeply matter to the most vulnerable of folks. And the other thing that we want to thank everybody here are all of you who have the courage to come forward and tell your stories. It's not always easy to feel like you can tell your stories, especially when they're stories of struggle or pain, when they involve personal details and members of your own family, when they can involve struggles with government that should have done better, schools that should have served better, institutions that should have been there before. But this is partly what we're trying to push hard on. We want to assure everybody here that Councilman Dom, myself, and other members of City Council are fully dedicated to seeing an expansion in the number of services to youth who are experiencing homelessness, not 5 years down the road, not months and months later, but we're looking to move something as in the next fiscal year. And with your support and with your voices brought to the table, we know that we can make this a priority for our city. And this is a long-term partnership that I see going forward. This is not going to stop here today, but all of us really need to form a strong coalition and voice to put our faces out there, to not be afraid to tell our stories, to be both seen and heard, so that these issues can reach the kind of level of change that needs to happen. We're going to open up with a very brief video made by our partners at NBC 10, who did a really wonderful series on this issue.
I'm learning how to grow up and be a man of my own. You know, being out here and, you know, being in the system of the shelters and stuff like that. I'm only 20, but I'm dealing with a lot right now. And she told me I had to get out. And I came to Philly. And it was January. And I was just sleeping anywhere I could sleep for about a month. If something would happen, like my transfer stopped working and the bus driver wouldn't let me on, I would just find the nearest park.
I've been in and out of foster care and homeless shelters since the age of 12 going on 13.
One time though, I was in the sun, riding the cell back and forth. For real, I didn't even think I was going to make it this far.
I didn't know that I was homeless. I didn't know that I fit the definition.
Today, we will turn a young person away from this shelter. We will turn a young person away and say, I'm sorry, I don't have a bed to serve you. I don't have a bed to keep you safe.
I just try to stay up as long as I can. Other than that, like, someone would tell me I could, like, sleep at their house or whatever. I didn't think I would be out here this long. It's like hell.
About a month ago, I lost my apartment. I lost custody of my beautiful daughter, and the drugs became everything. Heroin became everything. Yeah, sleeping in my car, and then sleeping at the park right on Lehigh.
During the day, it's a little bit safer. At night, people will be down there waiting for you. They'll bust you upside your head and take your stuff.
I run around at night and they sleep on the bed. Whenever they got to go home, make shift today.
The City of Philadelphia has made tremendous, remarkable, inspiring progress ending chronic adult homelessness and entering veteran homelessness. But unfortunately, the City of Philadelphia, the city of brotherly love and sisterly affection, has left homeless kids out in the cold.
Lord, you've been so good to me. The hardest part for me was to bring my daughter.
Frankly, if we don't catch them here, the date is clear. They are going to go on, many of these kids, to become the next generation of chronically homeless adults.
I'm a fighter. I know how to survive.
I'm learning how to grow up and be a man.
All right, well, thank you very much. And I want to reiterate thanks to so many people here who care so deeply, to our providers, to our city agencies, to our advocates, and to the young people who are here today as well. We're going to get started. The clerk will now read the title of the resolution.
Resolution 160235, authorizing the Joint Committees on Children and Youth and Housing, Neighborhood Development, and the Homeless to hold hearings to discuss the issue of youth homelessness in Philadelphia in order to work towards a strategic plan to address this issue.
Thank you very much. The clerk will please call the first witness to testify on the resolution.
Panel 1, we have Office of Supportive Housing, Liz Hirsch, Department of Human Services, Gary Williams, and the Mayor's Office of LGBT Affairs, Nellie Fitzpatrick.
Good afternoon. Welcome.
Thank you. Good afternoon. Gary, you going to leave me alone up here?
Absolutely not.
Okay.
If you could please just state your name for the record and proceed with your testimony.
Thank you.
Thank you. And we'll go through all three of you first and then have some questions.
Good afternoon. My name is Liz Hirsch. I'm the director of the Office of Supported Housing. This is the city's department whose mission it is to provide the planning, coordination, services to make homelessness rare, brief, and non-recurring. I want to thank you, Councilman Dom and Councilwoman Gim, for giving us this opportunity to testify on the critical issue of youth homelessness. I was noticing that today is Bring Your Children to Work Today this morning, and this afternoon is Bring Our Children Home. The Office of Supportive Housing work is accomplished through partnerships with providers such as those who are here today and with other governmental agencies, HUD, the Housing Authority, the Department of Behavioral Health, and DHS. And together, this network provides a range of homeless outreach, engagement, prevention, diversion, emergency assistance, case management, and supportive services. And together with all of that, we are able to address a small part of the needs of this community to keep people stably housed. Before her untimely death, Dr. Perlman, Stacy Perlman, documented the lifelong untold costs when young people experience homelessness in their early years. They're more likely to commit suicide, suffer behavioral and physical health problems, be system dependent, and poor. Too many young people in Philadelphia experience homelessness. So how many young people are homeless, experiencing homelessness in Philadelphia? Well, the short answer is we don't really know. And the other answer is it depends how you count, how you define homelessness, and how you ask. But I'll tell you what we know so far. Each year, the Office of Supportive Housing is required to conduct a point-in-time survey. This is done on January 27th in the middle of winter. This year, we found 705 people who were without shelter. We estimated that 4 to 8% of those people were 18 to 24, which brings us somewhere between 21 and 42 individuals. And of those in overnight cafes, 4 were between 18 and 24. We know that in emergency and transitional housing programs, that there were 257 unaccompanied youth under the age of 24, 20 under the age of 18, and 291 parenting youth households, representing a total of 703 young people at that moment in time. But I think we can all acknowledge that the point-in-time count is likely to undercount young people who are experiencing homelessness. Under the leadership of Valley Youth House, with the OSH funding through the HUD Continuum of Care Planning Grant, the Youth Count Coalition conducted 4 counts in 2015, January, June, August, and November. And of the 252 people they surveyed, 55% were unstably housed, that is couch surfing, 22% were homeless, 11% in shelters, 11% in outdoors or public transportation centers, and 1 in a drop-in center. A total of nearly 200 of the individuals were identified as either homeless or unstably housed. Hear from Covenant House and the young people who are here today that they turned away 546 youth because of lack of places for people to go. I think we can stipulate that 1 is too many. It just is useful to know what the magnitude of the problem is for resources and planning. So Philadelphia is pleased to now be part of an innovative national research project being conducted by Chapin Hall to look at, called the Voices of Youth Count, to use a youth engagement approach and peer network to more accurately capture the number of youth experiencing homelessness. And we look forward to having this data. We think it will be very helpful. So let me turn my attention now to the resources that exist. There are currently, and I've provided this for your information in as much detail as we were able to come up with, there are currently 388 service-enriched housing beds for homeless youth in the city. 5 programs provide a total of 109 emergency housing beds to young people ages 13 to 24. 8 programs provide a total of 223 transitional housing beds, and 3 programs provide a total of 56 permanent supported housing beds. So even with these sobering numbers, and they are sobering, our situation is far from homeless. We can rewrite the future history of our children by providing 4 core outcomes, and the sooner the better: stable housing, permanent connections, education and employment, and social and emotional well-being. And because young people's brains are still growing, they are resilient. So it is critical that we take action now while people are young to help them break any cycle of homelessness and poverty. The Office of Supported Housing conducted a very quick survey of homeless youth-serving organizations, the demand for their services, the need and potential capacity to address this need in the coming year if they had the necessary resources. We believe that we could, within a relatively short time, implement a comprehensive collaborative strategy of homeless outreach to youth, intervention, housing and services to interrupt and address youth homelessness. The model would be that which our youth homeless providers currently use. It would be resiliency-based, trauma-informed, and built on positive youth development. We believe that they could, with a modest investment of $3.5 million, provide an estimated 400 homeless young people with emergency housing, rapid rehousing, and/or transitional housing, conduct extensive year-round outreach and engagement to youth experiencing homelessness, and the legal representation, if needed, to reconnect them with school. This is within our grasp. Ending youth homelessness is not out of reach for Philadelphia. We welcome the opportunity to work with the provider community and with City Council, with young people themselves, to make our vision of a city without youth homelessness a reality. Thank you again for this opportunity.
Thank you so much, Ms. Hirsch. And before Mr. Williams started, I wanted to acknowledge the presence of two of our fellow colleagues on City Council. First and foremost, I want to acknowledge Councilwoman Janie Blackwell, who has been a leading advocate on the issue of housing and homeless for this city for many decades, former chair of the Housing Committee on City Council, and has been a passionate advocate on this issue. So thank you very much, Councilwoman Blackwell.
Thank you very much. This is such an important issue and such an important committee, and so well attended. We certainly thank you for all the work you've done, and may I say a couple words?
Absolutely.
And for all the work you've been doing with children and youth. This is an important committee, and Councilwoman Gem has worked so hard on this issue and is always trying to work with children and youth. So we thank everyone on this important committee. We've had hearings over the years. I think that she's bring new energy and re-energize us to deal with this struggle. Many, many years ago, we had hearings on University City High School, and many people, some of you know, you adults do, but University City High School will be a new school because you know that school was torn down. And it's in the heart of University City. And we had hearings on young people becoming independent parents. We did a lot in our work with homelessness and those who need help and those who need places to stay, to talk about the important issue. And your leaders here at the table know what we mean when and some of you know when we talk about filing as independent adults, whether or not it was good to do or bad to do. And we had a lot of discussion about what is best, because being an independent student has its benefits, but it also has a lot of detriments. You really have to pay for yourself when you do that. But there are so many young people who have children and who are still in school and who need help. That's a real important, a whole part of this issue. Another important aspect of needing housing is certainly another important part of this issue. As you know, in dealing with homelessness so long, we've also had the discussion about how youngsters look when they go to school. Children who go to school and who come from a shelter shouldn't be identifiable. And too often, children don't have their hair combed, or they still have issues with hunger, and which is why we had hearings recently on what happens when schools are closed for so many youngsters who need food, and what do they do all day when they have several of their meals at school. So we realize that when we're dealing with housing and dealing with homelessness and dealing with young people, there are many aspects thereof that we have to deal with. Certainly representing PEC, which is the oldest shelter in the state, has been a real important aspect of it all for me. And I'm proud to be in the area to represent West and Southwest Philadelphia, where there is so much we can do. But again, we'll come back later and say a few things, but we want to thank my colleague, Councilwoman Gem, for this, and Councilman Alan Dom, because they are really interested in this important issue, and we want to do what we can to improve the quality of life and help our system and work closely with leadership so we can do that. Thank you, Councilwoman.
Thank you so much. And if I could just take a moment, Councilwoman Blackwell, you've been a true leader on the issue of housing and homelessness for decades in this city, and an issue in which so many people don't take the time to pay attention to it. You've been really fighting to get that. So this new, I just want to take a moment. And we also have another 100 people in the balcony, so thank you very much. I also want to acknowledge a new colleague on council, Councilman Derek Green, as well.
Thank you, Madam Chair. I just want to say a few brief words. Having worked for Councilman Tasco for a number of years, we've often worked on these issues and dealing with not only public health, but also the area of supportive housing and these issues, especially in reference to homelessness. One of the concerns I've had is homelessness actually as it pertains to children who are also in foster care. Councilman Task was very active with the Rise Charter School, which is no longer with us, and now we have the CB Community School, and I've had an opportunity to visit the school and really want to help support them going forward. But this issue of homelessness, especially as it pertains to children and youth, is something that's really troubling and concerning, because these are our most precious citizens in the city of Philadelphia. And prior to working with Councilman Tasco, I worked for a number of years in the city's law department, where I used to represent the Office of Supportive Housing and working with the Office of Housing and Community Development and working with Community Development Block Grant and seeing how those dollars not always where they need to be to really work in the area of housing, especially for our most precious individuals. So Councilman Gibb and Councilman Dom, thank you for your leadership and advocacy on this issue from some of your earlier tours and walks in the city about and bringing additional light to the issue, as well as Councilman Blackwell has been on this forefront and on the battlefield for a long time dealing with issues of homelessness.
Thank you so much, Councilman Green. Thank you very much for your patience. And Mr. Williams, please proceed with your testimony.
Thank you so much. First and foremost, I want to just also echo my gratitude and appreciation.
Just state your full name for the record.
Will do.
Thank you.
I'm Gary Williams. I'm the Deputy Commissioner for Children and Youth Division at DHS, and it is my privilege and honor to be here, a part of this hearing on today. I just wanted to simply thank all of the council members for your leadership, your effort, your passion, and directing attention to this very important matter. Thank you. I'm here today to testify regarding resolution number 160235, authorizing the Joint Committees on Children and Youth and Housing, Neighborhood Development, and the Homeless to hold hearings to discuss the issues of youth homelessness in Philadelphia in order to work towards a strategic plan to address this issue. I will talk briefly about the connection between homelessness and the child welfare system and some of DHS's efforts in this particular area. The issue of youth homelessness in Philadelphia is very much related to child welfare. The Federal Administration of Children and Families, Family and Youth Service Bureau recently released a data collection study gathered through the Bureau's Street Outreach Program. The results provide an overview of the grim circumstances for homeless and runaway youth and their history of involvement in child welfare system. The study indicated that more than half of the youth identified as homeless had been in foster care, and youth with foster care history had been homeless for much longer, 27 months on average, compared to youth who had never been in foster care, 19 months on average. Youth that had been in foster care were more likely to have experienced a violent episode versus those that had not been in foster care. Former youth had a higher likelihood of being in mental health facilities, 47% versus 21%, were more likely to have spent time in a drug or alcohol treatment facility, 17% versus 9%. While this data is national, I believe that it is consistent with the profile and experience of homeless youth in Philadelphia. The youth most vulnerable of becoming homeless are those who leave our system at age 21 without finding permanency. For example, in fiscal year 15, 235 youth aged out were 18 to 21 years old and left the system without reaching permanency, permanency being defined as reunified with their family or finding a permanent adoptive or custodian house or placement with a relative. In this fiscal year through March 31st, 2016, 176 youth aged out. DHS is making a major concerted effort to find permanency for these youth, as we understand how important it is to their long-term stability and overall success as adults. DHS also serves many families that are accepted for service, partly due to inadequate housing, frequently coupled with other reasons. For example, in calendar year 2015, there were 276 cases, which translates to 8.5%, that were accepted that had inadequate housing or homelessness in the allegations. These are families that are being served by DHS but may contain youth or have older youth as head of household. Like homeless youth generally, foster youth in particular are at heightened risk of being involved in sex trafficking. DHS is in the process of a major initiative to screen, identify, and provide services and referrals to youth who become known to DHS who are the victims of sex trafficking. These efforts are mandated by the Federal Preventing Sex Trafficking and Strengthening Families Act. DHS is currently one of 6 counties piloting a state screening and assessment tool and is working diligently internally to try to develop specialized services and resources for this particular youth. There are currently very few resources to meet this specific need. We are also aware that a significant number of homeless youth are LGBT. At DHS, we are working to identify resource foster homes that are specifically LGBT friendly, so that LGBT youth who have ended up in foster care, sometimes due to the lack of family acceptance, will have a safe environment to call home. By identifying LGBT friendly resource homes, we are hoping to break the cycle of youth leaving foster care, sometimes due to lack of acceptance or understanding by foster parents, only to end up homeless. There are many things that DHS tries to do to prepare youth in foster care for transitioning to adulthood and to avoid homelessness and the heightened danger that such a situation places on youth. Our Achieving Independence Center, AIC, exists to provide a safe communal space where youth in or formerly in foster care can be connected, educated, and empowered as they strive toward attaining and maintaining independence. The AIC is dedicated to providing support and real-life tools for youth who want to make an investment in their future. Youth work with AIC coaches to create a customized service plan that will help them achieve their goals related to completing high school, GED, enrolling in college or vocational schooling, computer literacy, employment, career planning, housing, permanency, and personal development. The AIC focuses on helping youth to develop the life skills that they will need to get and maintain an education and or a job, and to obtain and maintain housing. The staff at AIC, as well as the youth case manager, also strives to connect the youth with mental health and drug and alcohol treatment resources as needed. DHS also has a housing unit which manages a number of programs to aid youth in finding stable housing. Responsibilities of this unit include maintaining the referral system, providing support to DHS and community umbrella agency social workers, assessment of clients' need to determine eligibility for appropriate housing, maintaining current logs for data purposes, attendance at monthly housing meetings, participation at citywide housing committees, and conducting housing workshops for both parents and youth. The housing unit assists families to find both permanent and supportive housing. With regard to permanent housing, DHS collaborates with the Philadelphia Housing Authority and the Office of Supportive Housing on several programs, including the Family Unification Program, the Shelter Plus Program, and the FAST program, the Family and Supportive Service Team program, for heads of households who meet the certain criteria to provide housing and supportive services. The total number of families served in permanent housing is 525. These units are for families, and while not youth-focused, are part of DHS's overall efforts. The housing units help youth to access the supportive housing program, which provides supportive services and housing to achieve self-sufficiency and independence for youth 16 to 21 who meet the following criteria. 1, are considered to be homeless according to HUD. 2, previous placement history with DHS. And 3, are current residents of Philadelphia. The supportive housing program services are provided through the collaborative efforts between PHA, OSH, and DHS. Services involve life skills instruction, counseling, job readiness, education, academic guidance, cash supports, medical, and mental health linkages. Valley Youth House provides supportive housing and services to youth who present as homeless. Carson Valley Children's Aid Transitional Housing Program meet the unique needs of older homeless youth, 18 to 25 years of age, who are Philadelphia residents. This program services both parenting and non-parenting youth. Northern Homes provides transitional housing to homeless mothers and their child between the ages of 18 and 21 years of age who have aged out of care and have exited care. This program is based on residential suites and may house a mother up to 2 children. Methodist Fresh Start is a program developed to serve youth who have exited the foster care, group home, or supervised independent living programs and who have become homeless. The project is especially designed to serve females with special needs who may be pregnant or who have an infant. PHA Quads is a supportive housing program and a transitional housing project in which older youth receive housing and supportive services in order to facilitate their capacity to be successfully discharged to self-sufficiency. The program is designed to house 4 efficiency apartments in 1 unit. Unfortunately, the total number of youth served in supportive housing is 70 youth, which is in no way addresses the vast need for services for youth transitioning out of foster care who are in need of housing. Room and Board program provides temporary housing for youth 18 to 21 who have exited the foster care system and are now requesting to re-enter care due to experiencing homelessness in Philadelphia. There are 12 to 15 units. Finally, Pride is a housing resource we refer to under the auspices of Valley Youth House. It creates a safe space for youth who identify as LGBTQ. It provides first, last month, and security, as well as case management services for a period of 3 to 6 months. The case management services are aimed to connect youth to services such as Mazzani and the Attic for the support and the LGBTQ community. They provide both individual, group counseling to help address issues that range from housing discrimination to education around gender identity. We are aware that much more needs to be done to meet the needs of youth in care transitioning to adulthood so that they will not end up homeless. We look forward to partnering with City Council to develop solutions and resources to meet the needs of homeless youth here in Philadelphia. Thank you so much for this opportunity to provide testimony on this very important issue. Thank you.
Thank you very much, Mr. Williams. Ms. Fitzpatrick?
Thank you, Councilwoman. With the permission of the committee, I would like to invite 2 friends who are here up to submit testimony as part of the Office of LGBT Affairs testimony here before the council. Sure. Thank you. Thank you.
Good afternoon.
Good afternoon, Chairperson Gim and Chairperson Dom and the members of the Joint Committee on Children and Youth and Housing, Neighborhood Development and Homelessness. My name is Helen Fitzpatrick, but most of you know me as Nellie. I'm the Director of Lesbian, Gay, Bisexual, and Transgender Affairs for the City of Philadelphia. I'm here today to testify on resolution number 160235 to discuss the issue of youth homelessness in Philadelphia in order to work towards a strategic plan to address this issue. I applaud and I'm grateful for all those who have worked to ensure that youth experiencing homelessness are present for and participating in today's hearing. I would like to take this moment to publicly thank my friends Kamar Jewell and Fantasia Washington for joining me here today and submitting testimony as a part of the Office of LGBT Affairs testimony before you. As a proud lesbian and devoted Philadelphian, it is an honor to testify before you all today, and like so many in our diverse community, I am grateful to live in a city that has made such incredible and inspiring strides towards equality. However, we must all remain keenly aware of the enormous amount of work there is still left to do to achieve equality for all LGBT communities and people here in Philadelphia. Ending youth homelessness is one of the most critical challenges that together we must meet and conquer. Youth experiencing homelessness live at the intersections of various marginalized identities: race, gender identity and expression, age, sexual orientation, immigration status and ability, and many more must be considered in the discussion surrounding homelessness and the tremendous impact racism, poverty, and identity have on these young people. A disproportionate number of lesbian, gay, bisexual, transgender, and queer youth in our country today have or are experiencing homelessness. Nationally, LGBT youth make up only 5 to 7% of the overall youth population. However, 32 to 40% of homeless youth identify as LGBT. Here in Philadelphia, 2015 youth count revealed that up to 54% of homeless youth identify as LGBT. Meaning, over half of the population this committee is formed to serve identify as LGBT here in our city. Studies by the National LGBTQ Task Force and True Colors reveal that LGBT youth are significantly more likely to experience victimization on the street and experience longer periods of homelessness than heterosexual and cisgender youth. The result is a disproportionate number of LGBTQ youth who engage in survivor crimes, resulting in incarceration and criminal records that compound their marginalization, placing them in further states of homelessness and vulnerability. For lesbian, gay, bisexual, transgender, and queer youth experiencing homelessness, a coordinated community-wide system of services, organizations, and providers must make an organized and corresponding effort to end the homelessness and housing instability. Everyone serving LGBT youth through social service agencies, educational systems, the juvenile legal and justice systems, and the child welfare system must work together to make sure these types of assistance are created and that youth are able to access and fully understand the available services. All programs and people within these systems must have the competencies and confidence needed to serve all LGBTQ youth. And most importantly, there should be enough assistance for everyone, not just a selected few. For a very long time, LGBTQ youth have relied on a few underfunded, community-driven providers. It is time for us to listen, learn, and build together with the youth and those who have fought for them and with them for decades to end this devastating problem. While I am confident you will hear of the enormous barriers faced by all homeless youth and the critical need for more services, shelters, beds, and opportunities, it's imperative that this joint committee remain cognizant of the additional needs of and barriers faced by LGBTQ youth, as they are over half the youth you are aiming to serve. It is imperative that we all listen to the LGBT youth who have or are experiencing homelessness and involve them in the conversations and solutions we are all aiming to create together. Thank you for allowing me to testify in this measure, and as further testimony from the Office of LGBT Affairs, I would turn my time over now to whoever wants to speak first.
Hi, welcome. And if we'll take your testimony as well, and feel free to summarize it.
Sure.
You don't have to read all of it, but if you could just tell your story, that would be great. Thank you.
So, hello everyone. My name is Kamar Jewell. So, I want you all to try and imagine not having a place to lay your head at night. Imagine having to fantasize about food just to stop your stomach from growling. Imagine not being able to take your own personal belongings with you everywhere you went. Imagine encountering sexual abuse, physical abuse, verbal abuse almost every day of your life. Imagine going through all this simultaneously while faking a smile so that everyone thinks that you're okay. Now imagine going through all this and you're not even 18 years old yet. For a lot of youth, especially LGBTQ youth in Philadelphia, they don't have to imagine any of this because this is their reality every single day. And the reason why I am here today is because I was one of those people. When I was 16 years old, I was kicked out of my home and forced onto the streets of Philadelphia. Through my 2 years of homelessness and couch surfing, I dealt with physical abuse, verbal abuse, emotional abuse, financial abuse, and of course, sexual abuse. And sometimes I sit and think about how many, wow, I really have to sit and count sometimes how many times I've been raped. I've been raped 4 times, and each one was worse than the last because I have to sit and say to myself, I let that happen again. And all that happened because I had nowhere safe to go. Even to this day, I'm still going through therapy for these and other traumatic events during the era of my life. At times I had to steal and even use my body just to be able to get a meal or even place my head down at night. I dealt with all this while being in high school, and we already know how hard that is alone. The worst part about all this was that I felt like I had no one to talk to. No family, no friends, no school peers. I felt alone, and that made my situation 10 times worse. To kind of get a glimpse of what I was going through, in my senior year of high school, I stayed up with a friend in West Oak Lane, and I was going to school out in the suburbs. I would get up at 4 a.m., leave out at 4:30. I would catch 3 buses and 2 trains to get to school. I would be in school from 7 a.m. to 2 p.m. I would leave and go to work from 3 p.m. to 9 p.m. I would head all the way back to the crack of West Oak Lane around midnight. By the time I shower, ate, did my homework, and ironed my clothes for the next day, it's about 1:32, and I have to get back up in 2 hours again just to go to school. And I did all this for about a year while I was in high school. My life didn't turn around until I started going to the Attic Youth Center, Philadelphia's only LGBTQ youth center, and I started receiving counseling, meals, tutoring, HIV services, help with scholarships in my FAFSA, and even more. The most important thing that they did was link me with Val Youth House. Val Youth House provided me with classes that improved my life skills and prepared me for the real world by teaching me about leases, credit, saving money, and so much more. Once I completed their program, Val Youth House helped me to find my first apartment, and they paid for all my moving costs and even my first few months' rent. I'll never forget that day, September 1st, 2010. That was the first day that I moved into that was the day that I moved into my first apartment. I remember walking in and just laying on the floor and starting to cry because that was the first time in a long time that I felt like that the world did not hate me. From that day forward, I vowed to be the best me that I could possibly be. Today, I stand before you as a college graduate who is currently preparing for grad school. Today, I stand before you as a professional dancer. Today, I stand before you as a professional dancer and director whose artistic work has been featured in Huffington Post, MSNBC, Fox News, and the list goes on and on. I even had the blessing of going on tour in Europe last year for 4 months just to do what I do best, which is dance. Today, I stand before you as a proud Black gay man who is working with LGBTQ youth agencies as a mentor to ensure that we have less people that have to stand up here and tell their horror stories like me. Because I believe that my ancestors died so I could be here and have so many opportunities, and I want to stand on their shoulders to ensure that I can help my future as well. But keep in mind, I am just one of the lucky few. Many of my LGBTQ brothers and sisters that have gone through the same things are now battling addictions. They may be incarcerated or no longer with us because of murder and or suicide. And just to think, I would have never gone through most of this pain and suffering in my life, mentally, physically, and sexually, if there was a place that LGBTQ homeless youth could go and, more importantly, feel safe. Now, finally, imagine a place in the city that LGBTQ young people can go and find a place to sleep and or eat. Imagine that young person being happy, healthy, and ready to take on the world day by day. Imagine that young person becoming the next president, the next great inventor, or even the next Kamar Jewel. Those are the things that I like to imagine because they are possible. It starts with me, it starts with you, and I hope that we can get it started today. Thank you.
Thank you so much for that story, and I know how personal that is, and we're very grateful that you were able to share it and also to talk about what it took to help make a difference. Thank you.
Thank you so much.
Thank you.
Thank you so much.
Hello.
Hi, my name is Fantasia Washington, and I work at the Attic Youth Center as a LGBTQ trainer. Youth homelessness is an incredibly multi-layered issue, and I wish I could simply name one cause or one solution, but in actuality it's a web of overlapping and intertwined barriers, and much like an actual web, the harder you struggle to escape, the deeper you fall into it. This is my web. In 2006, I started high school at Magnet School in Philadelphia. Within the first few months, I came out as queer, only to find immense homophobia from both youth and administration. From fights based in homophobia to in-house suspensions for hugging other girls. At home, I spent most of my time alone, an only child to an alcoholic and often absent single mother. I started the first day of my 10th grade year with a diagnosis of major depression, countless disciplinary write-ups on my record, and a letter telling me that I was no longer enrolled in my school and I had to leave immediately. They claimed that they sent letters out over the summer, informing me and my mother that I had been expelled. My mother explained that we were experiencing homelessness, so we couldn't receive mail. She explained that I had been diagnosed with depression and that I would not thrive in my neighborhood high school, but they didn't care. My mother was so genuinely afraid for me to go to my neighborhood high school that at 15 years old, I stopped going to school altogether. I never felt right saying that I dropped out. It wasn't until reading Dr. Monique Harris's book, Push Out, The Criminalization of Black Girls in School, that I understood what happened to me as school push out. Many people here already know the connection between education, employment, and housing. In Philly, 93,000 young people between the ages of 16 and 24 years old are not enrolled in school. Almost 46,000 are not enrolled in working, and the unemployment rate for youth not enrolled in school is 30%. I found myself trapped in a cycle. You need an education to find a job, and a job to afford housing. But how can I focus on school when I don't know where I'm going to sleep tonight? As much as we all like to think that this is an issue for 18 to 24-year-olds, this is very much an issue that existed for me at 16 years old, when I found myself on the streets with nowhere to go and no way to support myself. Like many LGBT young people, I chose the street over the child welfare system. For some of us, it's a lack of family acceptance. For others, it's alcoholism or drug-addicted caregivers. For others, abuse or neglect. I'd like to share with you a few quotes from a 2013 focus group with LGBTQ homeless youth put together by youth facilitators at the Attic, including myself and Kamara. My dad was an alcoholic who would beat his girlfriend. When I defended her, he threatened to kill me, so I ran away. My mom found out I was gay through her coworker. When I got home, all my things were in bags, and I wasn't allowed to live there anymore. After my father was murdered, my mom was in and out of rehab, so my sister and I stayed on the streets at 13 and 14 years old. Once on the street, homeless LGBTQ youth become nearly impossible to find. Some make the conscious choice to become invisible, often in an effort to avoid the child welfare and juvenile justice systems. This is the strategy I used. Avoid systems at all costs was a vital part of sustaining myself. This is frequently an effective survival strategy. 56% of LGBTQ young people in the foster care system spend time on the streets because they feel safer there than they do in their group or foster care home placements. And how could anyone feel safer on the streets? Of Philly, no less, right? The reality is that we, as a city, have not adequately provided the necessary supports to assure LGBTQ youth in this city find safe placements within the child welfare system. How can we find LGBTQ affirming foster parents when we don't ask young people entering care their sexual orientation and gender identity? We know that 54% of homeless youth in the city of Philadelphia are LGBTQ, but we'll never understand exactly how good these young people are at hiding on the streets until we collect the data to find out how many of these young people make it to DHS custody. Because what we do know is that many of these young people will instead enter the juvenile justice system, since homeless LGBTQ youth are 200% more likely than heterosexual youth to be arrested for status offenses like running away, truancy, and curfew violations. For youth who manage to avoid the juvenile justice systems, the child welfare system, homeless shelters is another option. But what happens when an LGBTQ young person is placed in the shelter system? Let's return to some of those focus group quotes. At the youth housing program, I was told that if I told my roommates I was gay, they would hurt me or try and sleep with me. I was kicked out a month later after someone placed a knife in my locker. I heard the staff trying to guess who was gay in the program, so I got scared and left. As a trans woman, staying at a shelter was as scary as it gets. When we hear these experiences and we think that more than half of the homeless young people in this city identify as LGBTQ, I hope it becomes incredibly clear that we must address this issue in full recognition of institutionalized heterosexism, homophobia, cissexism, and transphobia that exist within our child welfare and shelter systems. Let us require that youth-serving systems be LGBTQ youth-serving systems that recognize trauma not perpetrated. Let us create systems not built to diminish the power of young people, but to lift them to a power of command over their own lives. I was lucky to make it out of this web with love and support from the LGBTQ community, with individuals from organizations who saw my experience as expertise and lifted me to a place of command over my own life. Now I work as an LGBTQ educator with the Bryson Institute of the Attic Youth Center. In our work, we provide trainings on best practices for supporting LGBTQ youth in their everyday context, child welfare institutions, juvenile detention centers, foster care parents, teachers, students, and faith communities. In my work, I've learned that only through a point of intervention that addresses systemic trauma based in oppression can youth escape this web. We need DHS to collect data on LGBTQ youth to find appropriate placements. LGBTQ cultural competency needs to be mandated to any and every person who engages with a young person in the child welfare and shelter systems. Hiring practices and foster parent recruitment need to include LGBTQ cultural competence. We need shelters and affordable housing programs specifically for LGBTQ youth. We need to decriminalize status offenses related to homelessness and find LGBTQ youth beds that aren't in detention centers. But what we really need to do is begin to evaluate the systemic course of disenfranchisement we send every single young person in this city down if we remove every pillar of success possible from their sight. We need to address the failing education system in this city, the staggering youth unemployment rate, and the continued lack of affordable housing. And we need these things now, because if we're going to continue to call ourselves the city of brotherly love, we must remember that justice is what love looks like in public.
Thank you. Thank you all very much. Thank you. Thank you very much for your testimony. We really appreciate it. And if you could turn in your testimony to us, that would be very helpful. I know that our staff had a couple of questions for Ms. Hirsch and Mr. Williams. If you could come back up. Thank you to the panel very much for that.
Thank you very much, Council, for allowing the Office of LGBT Affairs testimony to be complete by including voices of the community.
Thank you.
Madam Chair,
Yes.
let me say, as bad as as bad as times are, I've been around so long, we didn't have any people on the streets folks knew who were gay, and it's always like that. Everybody knows the real deal, and but we didn't, as bad as it is now, we didn't have any home. Everybody just had to live with it, and people find their own way. So we're proud of these young people, and we admire their courage, and we commend them for standing up for the others, and you as well.
Thank you. Thank you, Councilwoman Blackwell. I had a couple of very quick questions for Ms. Hirsch and Mr. Williams, just in the interest of time. I know we have a number of speakers who are here today. But just for clarity, Ms. Hirsch, you were saying that about 90% of youth in the youth count do not stay in shelters, roughly. Like about 11% in the youth count are somewhere in the shelter system, but it looks like 90% do not feel or weren't counted there. Is that correct? From your testimony?
I'm not sure that that's what I said.
It just says that of the 252 individuals surveyed, how they were, how they were kind of sheltered or experiencing their situation.
Yeah, just
And
11% were in shelters.
Just a small percent were
Yes.
in the shelter system. And could you talk a little bit about what it is about the shelter system that is not responsive to young people?
I think that we heard what Fantasia said, right? She's an expert, and I'm so sorry for any harm that anyone has experienced in the homeless shelter system. I don't think shelters are the right place for young people. I think that they need to be in permanent supported or transitional housing programs or other kinds of residential programs that have specialized services that are tailored to their needs, with other kids and with staff who understand how to work with young people. That's really the ideal situation.
And then could you also talk a little bit about the federal grant that came through to take a look at the issue of homelessness in our city, roughly $28 million? And how flexible is that grant in terms of its usage in different areas? And is there any possibility of looking at it in terms of services for youth in particular?
There's no flexibility. It's project specific. It was all renewal funding for existing programs to continue them. And as Roberta Cancelier is here, is any of that for youth? Just notice them. Well, look, we'll get back to you with that number, but no, the short answer is that's not discretionary money. It's renewal funding. It was competitively scored through a lengthy process, and it's only for use by those projects that HUD determined could be funded.
Thank you. Councilman Dom?
Thank you, Madam Chairwoman. Thank you all for your testimony today, and also for the two other people who testified. Very moving testimony, very sad. I'm trying to understand, so I'm going to ask you a few questions that maybe you can shed some light on this issue. The categories of homeless youth, do you start at age 13? Is that the starting point? And does it go to, I'm looking at different categories, 13 to 17, then it goes 18 to 21, then there's another category that's 18 to 25. Are there three categories? I'm just trying to identify.
We count two different categories. Under 18, the 13 to 18, and they are, and that's because those programs are funded to serve what we call runaway youth, and then 18 to 24 because they're young adults and they may be parenting, they may be heads of households, or they may not be. That does not include any of the young people who come into our system with their parents.
Okay.
Those are just either heads of households, parenting heads of households, or young people who are not there with their parents.
And do we have any statistics on the numbers within those two categories of homeless youth right now, between 13 and 17 and 18 and 24?
The under 18, I think there are just 20 who are served in our system, and the older kids, let me see.
But how many would you estimate are out? I know 20 are served.
But out on the street?
What's the number that we're not serving?
That's really anybody's guess. Based on and Valley Youth House may be able to better answer this question. Based on their count, there were 252 that they counted in their most recent count. That was, I think, in January.
And that's 13 to 17?
No, that's anybody under the age of 24.
252 are not being served right now.
Well, and again, this is one count by one set of standards. So I would really caution using that number. I think you'll hear from Covenant House the number of young people they turned away. The problem with any of these counts is, as you heard from Fantasia especially, is that young people who are experiencing homelessness hide. They're afraid that if they're counted, that adults will intervene and take away make their lives worse, not better. And so it's really, I would say, it's the best we've got so far, but I would not build a system around those numbers.
And also in your testimony, I think you mentioned an investment of $3.5 million would provide an estimated 380 to 400 homeless young people with emergency housing, rapid rehousing, and transitional housing. Is that annually?
We didn't look at it annually. We were thinking about jump-starting the problem and intervening now. The information that I don't have, Councilman, is how long young people would be in any of those services, and whether they could use that as a springboard for independent living, or how long they would need a subsidy. Perhaps one of the youth service providers would have more expertise about how long the kind of duration of services would be appropriate.
I have another question. It might be for, is it Nellie? William Nellie? Yeah. I want to make sure I heard this correctly. Was there a recommendation that for youth LGBT we should have a separate facility, or can it be the same facility? Give us your opinion on how that should be.
I think you need a combination, and when we're talking about separate facilities, there needs to be a continuum of different options for LGBT youth. Some LGBT youth do want to access a place where the entire mission of the place is to empower them. Some do not. We see successes in places like the Ali Forney Center and True Colors in New York, and then you also hear from kids where those places have not necessarily met the needs for them. This is why it's important that throughout all the systems that already exist, we do the level of competency and confidence that's necessary and create an actual continuum so that an LGBT youth can actually navigate, understand, and safely move through these systems being empowered, but also have systems in place for them where they are truly focused on and exclusive for LGBT youth.
Okay, now the three of you are way more experienced than I am in this issue. And if we said to you, we want to solve this problem, how do we do it?
Find the money.
How much is it?
Millions.
Let's start with that $3.5 million that we know that the array of youth-serving homeless providers could immediately deploy to do outreach and engagement and basic survival needs of kids on the street, get them into residential care that's appropriate, the continuum, as Nellie said, and get reattached to school or employment, rebuild a peer network if they need to, that are trauma-informed, positive youth development-based. That we know we can do.
Okay, so it's $3.5 million to get started. And we're not sure, can you let us know maybe another date, if that's an annual expenditure or a one-time expenditure, just so we can understand it from a budgeting standpoint?
I would recommend that maybe, if I might suggest that would maybe something we could explore through the strategic planning process. We really provided that as kind of a quick estimate because we knew that was doable, and we're really looking forward to the opportunity to drill down in much more detail about what the range or the continuum is that would be needed.
Okay, thank you very much. Thank you for coming tonight.
Thank you very much, Councilman. The chair recognizes Councilman Green.
Thank you, Madam Chair. In reference to that amount, you said $3.5 million to really address the issue and have a substantial impact in reference to trying to end homelessness. Are you familiar with either social impact bonds or pay for success bonds? And if so, have you seen them used in this space? We had hearings earlier this year in looking at that type of funding for recidivism and also educational attainment. However, not necessarily if I've seen it in this space. So I'm curious if you've seen any research, any activities in other jurisdictions where that has been used as a funding mechanism.
This is not my area of expertise. My understanding is that social impact bonds are in their very early stages for use around homelessness. There is a theory that if people are stably housed, that it does save other systems money. There's questions about whether having a for-profit entity being involved and motivated is a plus or a minus and who really benefits. So my sort of my quick judgment based on what I know is that would be premature, and that might be something down the road that we could explore.
Well, the reason I asked that, because yesterday I was in a conversation also in reference to the public safety space, and the concept was in reference to providing housing for people who were returning citizens who often have a challenge and they need more long-term housing options. And there was a suggestion of looking at using social impact bonds in that space. And so thinking about homelessness, it made me think of that could also be another area where we could provide a possible funding stream to address this issue. Traditionally, the way social impact bonds have worked, you have a private entity that provides dollars to an intermediary, which is often a nonprofit associated with a jurisdiction. Then that intermediary will then provide the dollars to the social service provider. And then another component is that you have to have a third-party entity to really evaluate and set a benchmark of what would be the threshold upon which either the city would have to pay back the dollars that were invested or the private entity would lose money. So in thinking about the conversation of the past couple of days and the previous hearings regarding social impact bonds, it made me think that this type of public-private partnership may work in this space. So from your experience and also working with other providers in the field, are there those that provide data collection or research on how certain type of programs help address homelessness in reference to the funding or other measures?
Well, in terms of the social impact bond, just one small difference between the homeless system and corrections. Corrections has a very robust revenue stream, and you can track savings back in from that system by housing people and avoiding recidivism, so that there's a revenue stream there that doesn't exist within the homeless system. In terms of research, our local expert, Dennis Culhane at the University of Pennsylvania, is a great resource. Chapin Hall, which is doing the Voices for Youth Count this summer, that's affiliated with the University of Chicago, is another great resource on research that's been done to look at evidence-based and data-informed practices to address homelessness. Although I will say you have really a treasure trove of expertise here in this room with the provider community from the ground.
Okay. And just one other question, a slightly different topic, but still based on this issue. In reference to the issue of sex trafficking, I know that was something that was testified to earlier. I know Judge Lori Dumas has done a lot of work in that area. Has there been any work or outreach with reference to some of the initiatives that she's been doing to address that issue?
Yes, Councilman. Her efforts, we actually have attempted to partner, and we have partnered in many instances with Judge Dumas and also the state. In fact, the reference that I made with regard to the piloting initiative of a screening tool that would actually be mandated across the state, Philadelphia is one of 6 counties that's actually testing this particular assessment tool. So there is a local group that's working diligently, and then there's a state group that's working diligently on really identifying how to identify these young people, and not only identify the young people, develop resources to really help serve them. So there is some work being done. Much more is needed, and you'll hear more about that as we move forward.
Okay. Thank you.
Thank you very much, Councilman. Mr. Williams, do you know what percentage of youth in foster care age out of the system with a known housing placement? Do you track that?
Well, the closest statistic that I can give you today is the approximately 250 young people, approximately, aged out of the system without reaching permanency. Statistically, these are the young people who actually end up homeless and in some instances incarcerated, etc. We currently serve, in terms of dependent placement, we have over 6,000 children in care at current. So that gives you some kind of an idea of the children who are not reaching permanency.
And is that annually, or?
That we are, when you look at last fiscal year.
This is your total of the young people? so far?
Yes, Councilwoman. Yep. So
Okay.
when you look at last year, it was closer to 275 or in that area. And we are pretty much kind of on track to probably land at that number again, unfortunately, for this fiscal year. The department, we're actually involved in a system-wide strategic plan with increasing permanency. And one of the things that we're doing is trying to use our data to really speak to length of stay in foster care and actually do permanency case reviews earlier prior to a child aging out of the system. So at this point, we're identifying when young people stay in care at least 6 months, there's a required case review for that particular child. The other thing is we have our Achieving Independence Center. That initiative and program is really a one-stop shop for young people. Typically, historically, a young person had to be 16 to be referred to the AIC. We lowered the age requirement to 14. We understand that if we wait 16, 17, that's way too late in terms of helping young people with transition plans.
And how many students, how many young people in foster care tend age out in general?
Again, I would have to, the only number
I'm trying to
that-
get a sense of the 250 who actually age out without a placement, how that compares to the percentage of students who are aging out actually, as opposed to against the total number of students who are in the foster care system.
Yeah, I would have to get back to you with that specific information. What I can tell you is that we had over 5,000 children in care last fiscal year, and of that number, we had the 275 that aged out. So in terms of a comparison, I would have to look at the last several years to kind of really get a true depiction of how many children are actually aging out.
Because it sounds like against those numbers that the 250 is very high.
Yes.
That young people who leave foster care are unlikely to have any kind of known placement for them for housing.
For that particular, yes, for that particular.
For the aging out group.
Yes.
And that's a place to really focus a lot of attention on.
Absolutely. Absolutely.
Okay, well, thank you very much to this panel. I really appreciate it. We have, a number of other providers and young people testifying, and if there's any way for the city departments to be able to stay and hear some of these stories. I know your time's very precious, but it is really powerful stuff that I think people are going to be bringing. So thank you all very much.
Thank you.
Thank you. Could the clerk please call the next panel?
Panel 2, we have Labria Morgan, Joe Willard, and Carolyn Crouch Robinson.
Good afternoon. Thank you very much. We want to be respectful of everybody's time, and we know that many of you have submitted testimony. We have some of our staff who will just let you know when to roughly wrap up your testimony, and feel free to summarize. But thank you very much for coming and for your patience. And if you could just state your name for the record and then proceed with your testimony. So, Ms. Morgan.
Hi.
Hello, good afternoon.
Hello, good afternoon. Good afternoon. My name is Labria Morgan, and I am a young adult advocate for Youth Fostering Change. I would like to thank you for inviting me here to testify on such an important topic. I am an alumni of foster care who narrowly avoided aging out into homelessness. I am also an advocate for former and current youth in foster care. I aim to help them voice their opinions or or have their voices heard. I will also be graduating from Temple University in May. Youth Youth homelessness is very different from adult homelessness. Youth can experience homelessness in various ways. Youth homelessness can look like youth sleeping out on the street, just as adult homelessness. But it can also look like youth sleeping in cars, going from couch to couch, and even going to parties or other outings that they may not originally have even wanted to go to, just to have somewhere to sleep for the night. All these temporary fixes and others should be characterized as homelessness for youth. Youth who age out of care often don't have resources necessary to live independently. In my case, I aged out of care at the age of 21, and I did not have financial stability in order to live on my own. I had to pay for rent, utility bills for my apartment, food for myself, basic necessities, and also school costs, the cost of my textbooks that my financial aid did not cover. There's no way that I could, work and pay for all of these things while going to school. I asked for help from social workers, school counselors, school advisors, and received little to none. There was no room for me at my grandparents' house, and my parents didn't have the means to help me in my situation. And the only reason why I avoided homelessness was because the Juvenile Law Center helped me bring awareness to my situation through one of the speaking events that they have us speak at. This is not a common opportunity for a lot of other youth, though. Not everyone is encouraged to help themselves or advocate for themselves. And, not a lot of them are brought into speaking events where they're interviewed by news reporters in order to voice their situations, like I was. There are other youth and peers of mine that I know right now, right this second, that had to choose between somewhere to live and their education. And a lot of them chose a roof over their head as opposed to their education. And to this day, they're living paycheck to paycheck because of that decision, because that was a decision that had to be made. And there are youth, they're moving from house to house, and a lot of them have children with them. There are three ways that my peers and I three suggestions that we came up with for the prevention and decrease of youth homelessness in Philadelphia. One is earlier discharge and transition planning that focuses on plans for housing, income, education, and employment. The second was to change the definition of homelessness to reflect youth homelessness specifically, so resources can be directed at that problem. And the third was to provide supportive and subsidized housing for youth ages 18 to 25. Youth must start planning for their transition out of care at the age of 14, which is kind of done at the AIC currently, but the plan should be realistic and focus on concrete options for housing and how they will pay for it. This is possible by focusing more on the financial realities as opposed to spending so much time teaching youth life skills, learning to wash clothes, cook, clean, about health, and all the other life skills that they learn are very important, but they don't do much good when the young person has nowhere to go to implement the skills. DHS and private providers serving youth must devote more staff to help youth plan ahead. The staff should be well-trained and should like to work with young adults. Youth homelessness can also be prevented by changing the definition of homelessness to reflect the youth. As of now, youth are considered homeless if they're sleeping on the street or in a shelter. As I explained, there are other various ways that youth homelessness is manifest. So by including those aspects into the definition, we could bring in more resources for the youth. And lastly, which I think is most importantly, is the preventative step to create more housing opportunities for older youth, specifically ages 18 to 25. Society considers age 18 as grown, But when youth don't have the necessary support or resources, they can't survive on their own. Depending on the situation, youth in this age bracket should be granted subsidized or free housing or living arrangements. These housing opportunities should act as a stepping stone to help these youth reach complete independence. Many youth who age out end up in dangerous and unhealthy living situations because they don't have good choices or resources. For example, youth often move back in with the same family members they were taken away from, and the circumstances have not changed from that household. Or they may stay in or enter unhealthy relationships in order to keep a roof over their head. Youth aging out of foster care are strong, talented, and they work hard, but they need more support than they're given right now to be able to fulfill their full potential. Getting and keeping an affordable place and safe place to live is essential to helping them get the education and jobs they need to reach independence. If I did not get help with my housing when I aged out, it is possible that I would not be graduating next week. It is terrifying to think that all of my hard work and all the hard work of those who supported me and helped me through my journey would have been lost because I entered homelessness. I know that many youth do not have the connections that I have, and they don't receive the amount of attention that I did when I was about to age out of care, but we can help them, we can change that. And if we don't, we're going to continue to lose a lot of talented youth within the city of Philadelphia. By pledging to prevent and end youth and young adult homelessness, City Council can show youth, especially in foster care, that they value them and their potential. Because you invested in me and didn't leave me behind, you're getting a strong, smart, compassionate woman who wants to make Philadelphia a great place for all of its children and youth. I want more of my peers to have the same opportunities and resources that I did. But in order to make these changes, we have to, think of other policies and other resources that we can depend on that target my peers my age and, younger. So thank you again for having me.
Thank you so much, Ms. Morgan. I think I can speak on behalf of all of council that we feel very fortunate that you're out there talking to foundations and to other organizations and groups who have the wherewithal to keep driving attention to this issue. So thank you so much.
Thank you.
Good afternoon.
Good afternoon, Councilwoman. Thank you. My name is Joe Willard. I'm the Vice President for Policy at the People's Emergency Center. Our mission is to nurture families, strengthen neighborhoods, and drive change. We work out in West Philadelphia with families, children, and youth who experience homelessness. And I will shorten my testimony somewhat to pick up some time. I want to thank City Council for showing interest in youth who are experiencing homelessness in Philadelphia. PEC is enthused to work with you and the Kenny administration on this issue. The City of Philadelphia is facing a daunting task in the next 4 years as it considers what to do when working with its citizens who are experiencing homelessness. If you look at the data from the last 4 years from the Philadelphia Office of Supportive Housing, you could reasonably expect that some 3,000 families whose head of households is under the age of 24 will become homeless and access emergency housing in the next 4 years. The question is Philadelphia prepared? The good news is that the federal government and the state government are bringing some new resources and new funding and strategies. The City of Philadelphia needs to step up and consider expanding its part. The role of City Council is very important. Without the resources and leadership that you could bring to bear, the city will not succeed. The first thing City Council should consider is if Philadelphia can manage this crisis with the same level of resources that are now provided to the Office of Supportive Housing and with the same structure that is currently supported. Other than a new domestic violence facility created a few years ago, the Class 200 General Fund line item in OSH's budget has not kept up with inflation. In fact, there are fewer funds being proposed this year than the past year. If you can solve the crisis of youth homelessness by cutting budgets, then you shouldn't listen to any of us. In addition, the homeless system is really set up to work with adults, and there seems to be a huge and significant disconnect with it and the Department of Human Services. OSH is given the responsibility to work with all homeless persons, but in my opinion, not given the authority and not given the resources to manage the problem. Also, in my opinion, OSH does not have the staffing that is expert in youth, but they are incentivized by HUD to be our leader. The second thing that you should realize is that Philadelphia has not had a focus on homeless youth and are just beginning to work together, thanks in part to federal requirements. While that is welcomed, we strongly think that local leaders need to create local solutions rather than following 100% of the federal diagnosis and prescription. And because there has not been a focus, no one in Philadelphia can tell you how many youth are homeless, the amount of resources needed to end youth homelessness, and what the consensus goal should be. The number of homeless youth are determined by the funding stream and the reporting requirements. OSH serves an estimated 350 teens annually in the housing programs. It counted 299 unaccompanied youth and 300 parenting youth in the 2015 point in time count. The school district served 300 teens. If you look at something called the Youth Risk Behavioral Survey, which the school district manages, 9% of high school students ages 13 to 17 reported having ever considered themselves as homeless. Extrapolating the data, you're looking at 3,600 teenagers, 13 to 17, as having reported of ever considered themselves homeless. The next couple of pages are slides. You have the percentage of 11th grade homeless students in the school district. They scored lower on English, math, and science than the overall student body. You may ask, well, so what? Left unaddressed, homelessness places these youth at increased risk of dropping out of high school, unemployment, adult homelessness, and worse. All research known to PEC indicates that homeless youth have higher risk factors than housed youth in the domains of mental health, high school graduation, physical health, and more. For example, they are 3 times more likely to have committed suicide, almost 5 times more likely to have been injured during an attempted suicide, and a lot more that the Youth Risk Behavioral Survey will show, which I won't repeat here, but is in the slides before you. What is there to lose if City Council does nothing? Right now, more than 100 families per week and 40 adult youths per month are turned away from emergency housing. This is not new information. The former directors of the Philadelphia Offices of Board of Housing have been testifying to City Council since the year 2011, at least, that they are turning away families and cannot handle the volume of those who seek emergency housing. Many, if not most of these families and young people were either homeless or housing insecure in their teen years. Now they are homeless and cannot receive help unless they're lucky enough to get into the adult housing system. Continue not to address youth homelessness will cost you, in a few years, in unemployed adults, homeless families, remedial education, and workforce training, and a new group of young people on the path to not being productive citizens for Philadelphia. Second, I would tell you that the fact that services are not coordinated is not news. The 2007 report from the Mayor's Blue Ribbon Commission on Children's Behavioral Health, there was countless recommendations that the departments are not coordinating. So this is not news. Fortunately, city and nonprofit agencies are talking together in the past 2 years, and we're coming up with a lot of ideas and solutions. Some of them are that City Council could play a key role in is one, support the county administration's work to develop a unifying plan, which is what we lack. We need a plan. 2, consider a new administrative structure that connects OSH and the Department of Human Services and DBH. Support any strategy to increase the number of counselors, social workers, and nurses in each and every school by increasing access to high-quality early learning programs, double the City Housing Trust Fund to prevent homelessness, and finally, increase resources of OSH's budget by 10%. Thank you.
Thank you very much, Mr. Willard. I appreciate your testimony. I especially appreciate your taking care to delineate all the budget requests that have been made from OSH from 2011 to today, so very
Excuse me.
humbling.
Yeah, Labria has to get to school. Can she be excused?
Yes, absolutely.
Yeah.
Thank you so much, Ms. Morgan. Okay, Ms. Morgan, excuse me, Councilman Dom had one quick question for you before you leave.
I have two questions for you. Very nice testimony.
Yes, sir. Thank
What are you
you.
majoring in at Temple?
Adult and organizational development.
Have you been interviewing for a job?
No, not recently.
Okay, well, good luck with that. It's great you're doing that.
Thank you.
Congratulations.
Thank you. Thank you very much. Good afternoon.
Good afternoon. Thank you for the opportunity to offer remarks here today on behalf of Project Home Community, addressing the need to end and prevent homelessness among young adults in Philadelphia. My name is Carolyn Crouch Robinson, and I am the Director of Residential Services at Project Home, and I'm presenting on behalf of Sister Mary Scullion, who is unable to be here today. I'm joined here by members of the Project Home community, including young people who have themselves experienced homelessness who are interested in being part of this conversation. As you may know, Project Home operates 39 units of supportive housing for families, including as many as 100 formerly homeless children at any given time. We also serve youth in our Honickman Learning Center and Comcast Technology Labs and our Stephen Klein Wellness Center. However, I am here today to talk about the needs among young adults experiencing homelessness. Sadly, one of the fastest growing segments of the homeless population, and one which we see too often in the city-sponsored Homeless Death Review Team. In 2013, Project Home initiated a pilot, permanent supportive housing for homeless and at-risk youth, young adults, including those who are sexual and gendered minorities, ages 18 to 24. This pilot has grown to include 20 designated units and as many as 20 additional young adult units throughout Project Home. We are expanding partnerships with organizations such as Covenant House, Mazzoni Center, and the Attic Youth Center to meet the needs and to learn together how to best serve these young adults. The National Alliance to End Homelessness estimates that during 1 year episode there are 550,000 unaccompanied youth and young adults up to the age of 24 who experience homelessness for more than a week. Further, a 2012 survey of over 350 housing organizations nationwide, the Williams Institute found that 40% of youth clients identified as LGBTQ. On a local level, 4,689 students were identified as homeless by the School District of Philadelphia during the 2009-2010 school year. Additionally, 36% of homeless youth surveyed by Philadelphia Safe and Sound and the Greater Philadelphia Urban Affairs Coalition identified as LGBTQ. Together, this is 1,688 LGBTQ youths experiencing homelessness in Philadelphia, with many LGBTQ youth who are homeless also going unreported. It's clear that many of the issues leading to youth homelessness, such as family conflict, poverty, neglect, abandonment, physical violence, and sexual abuse exist both for LGBTQ and non-LGBTQ alike. However, according to the Williams Institute study, nearly 7 in 10 providers report family rejection as a major factor in LGBTQ youth homelessness, meaning a significant number of these youth are coming into shelters and/or foster care agencies as a result of involuntary separation from their families. Other youth may enter the system via conflicts such as truancy or criminal charges. LGBTQ youth are also twice as likely to drop out of high school in response to unsafe learning environments. For some, rejection and discrimination at home does not directly lead to an ejection from their house, but instead may result in social and emotional difficulties that can cause family relationships to become severed. As a direct result, youth may end up in the foster care system or homeless. Once homeless, these youth are particularly vulnerable. Research indicates that LGBTQ youth are at greater risk for physical and sexual assault, unsafe sexual behaviors, and have a higher incidence of mental health problems than non-LGBTQ homeless youth. Additionally, homeless LGBTQ youth are also twice as likely, 62%, to attempt suicide than non-LGBTQ homeless youth, 29%. Unfortunately, best practices for working with and supporting LGBTQ youth has not been the norm for child welfare agencies and housing programs. These youth have experienced abuse, trauma, and rejection specifically related to their sexual orientation or gender identity that often go unaddressed and/or are exacerbated. Many LGBTQ youth report feeling safer and prefer the streets to persistent harassment, discrimination, and neglect they encounter by staff, peers, and foster families. Transgender youth tend to identify even more difficulty when they seek shelter, as they are often placed without regard to their gender identity, which may lead to isolation and a lack of safety. The following data indicates that a current child welfare system is failing LGBTQ youth. 88% of professional staff working in out-of-home placements stated that gay and transgender youth were not safe in group home environments. 78% of LGBTQ youth were removed or ran away from their foster placements as a result of hostility towards their sexual orientation or gender identity. 56% of youth interviewed in a New York City study of LGBTQ youth in foster care spent time on the streets because they felt safer than they did when they were in their group home or foster homes. As a result of these conditions, many LGBTQ youth age out of the child welfare system and become homeless young adults. Project Home plans to designate over time as many as 100 units specifically for homeless young adults who need access to safe, inclusive, affirming, and culturally sensitive housing opportunities and supportive services. In 2013, we launched a young adult pilot program at JBJ for 8 transitional age young adults experiencing homelessness, aging out of foster care, or coming from other institutional settings, and we expanded the pilot to 20 units just a few months ago. Project Home provides permanent housing and supportive services as a base for residents to achieve their long-term goals for housing, education, and employment. All of our young adults are working, at least part-time, and most are in college at this time. As you probably know, primarily through collaboration and strategic uses of resources, Philadelphia has made tremendous strides in supporting our most vulnerable citizens. We have functionally ended homelessness for veterans. People with serious mental illness can find their way to housing. We have the lowest per capita rate of street homelessness among major cities despite high poverty. As a city, we have prioritized providing permanent housing, the most effective tool for both addressing and preventing homelessness throughout our communities. Our work at Project Home and at providers across the city is focused on an overall strategy consistent with the federal plan to end homelessness, ending veteran homelessness by 2015, chronic homelessness by 2016, among children, families, and youth by 2020. It is our hope that this council will join us on the journey to achieve these goals because none of us are home until all of us are home. We hope to help Philadelphia create policies that improve life, not just for the most vulnerable Philadelphians, but for the whole community, because none of us are home until all of us are home.
Thank you very much. Thank you very much. I had a quick question for Mr. Willard. You know, obviously many of us we recognize that a lot of the problems that have been going on within all of our city services are longstanding. They're difficult to kind of, both as some of us who are new to city council and those of us who have been working on this issue for many decades understand. But your second recommendation that this new administrative structure connects OSH and DHS. So they're in an umbrella under Eva Gladstein. And then the question is, do you have, like right now, a very specific area that they need to directly align on? And I think that we've gotten some indications that clearly this aging out in the foster care system is very, very obvious to us. But are there very specific areas that we could take a look at so that we could see some movement? I know that, you know, just saying that these departments should align is very vague and difficult and will take us a very long time before that happens. But if there are specific areas that you could speak to, that would be helpful.
A couple things, right? So there's this concept of having an interagency council on homelessness, which tends to be reporting directly to the top executive whether it's the mayor or the managing director or something like that. So it's a concept that's being played out throughout the United States. There are some cities that have some of these things. It's mostly a state-oriented thing. But the concept is to really have those 5 or 6 departments that touch upon the population and be led by somebody who has authority to get those 5 or 6 agencies to actually implement a plan. So that's it, yeah. It's,
Thank you very much. Councilwoman, the chair recognizes Councilwoman Blackwell.
Thank you. So, the issue still seems to be kids aging out. I mean, in the old days, when they aged out, they were told options. But I'm told that some of the issues are that not only when youngsters are aging out, do they not have follow-through, but if they're acting out, if they have other emotional problems or so, in a lot of the places they're told they have to go if they don't act out with no place to go. And that's what, and that we really want to respond to and get some answers to. If you can't be where you want to be, you got to at least be able to be inside. So, could you or someone else here respond to these? What happens when youngsters in various shelters, when they have problems there, don't get along with management or don't get along with each other? What happens to them? And then what happens? What is the general system of follow-through for those aging out?
Councilwoman Height, great to see you again. I think some of the speakers coming up can speak specifically about the foster care population. I think at PEC, we have staff available on a crisis basis. They're there 24/7. And you also may hear from some of us that there needs to be more either drop-in centers or a combination of types of programs where youth can access excuse me. They can access services quickly. Excuse me.
I would also say that since 2009, we've seen a huge increase in people aging out of foster care that are not getting placement. So really working with that population. Earlier you mentioned 250, really working with that group too. I'd also say that there's a large population of young adults who do not go into shelter. And those are the group, we have the Couches Don't Count campaign that I'm sure will come up later with Valley Youth House and others. People just don't come into shelters. They're not made for young adults. People don't feel safe in the shelters, and for good reason. So having other options within that continuum and that safety net is really important.
Yeah, but they have to be told something. You can't tell a 16-year-old, it's not working, so I'll see you. Or you're arguing, and so you got to go. You can't tell her, because technically, according to the law, we have to do something, because they have to have some kind of case management provided for people who have behavioral health problems too. How do you all deal with that? Those who have behavioral health, what kind of case management do those with behavioral health issues get?
Well, within the Department of Behavioral Health, if someone does have a serious mental illness, they are able to get intensive case management services. We do have mobile psych rehab for people that are within our supportive housing network. So there are options. There's also lots of peer case aides and peer facilitators that can also be linked with people who have serious mental illness. So that's within Department of Behavioral Health. DHS, I can't speak to that as much, for people that are aging out of foster care without plans.
So behavioral health, you're saying at your specific sites or somewhere downtown or what? Because we're really not getting specific answers.
Sure. So I can speak to Project Home, and we do have the ability to have ICMs, peer case aides, peer support, and mobile psych rehab for anybody who does have a serious mental illness diagnosis. And we have plenty of folks that do have that support right at Project Home. Our issue is that we are just getting into young adults, and serving young adults and developing permanent supportive housing for them. So right now we're at about 40 people, and we hope to expand that to about 100 people by 2019.
People who deal with this
Young
level?
adults. So young adults aging out of foster care, coming out of homeless shelters that need housing. And then we have wraparound supports with employment services, health services, education services, but also if someone has a special need, then more intensive services that I spoke about before.
And you're saying you have about 40 youngsters in
40
that?
right now, yep. We started getting into this in 2013. So this is new for us.
I know. Yeah, life changes, Thank you.
Thank you very much, Councilwoman. Thank you very much to our panel. We really appreciate it, and we're sure we'll be following up with you both. We'd like to, could the clerk please call the next panel to the
Panel
front?
3, we have Charisma Cooper, Shani Meacham, Kate Gormley, Marianne Bellasort, and Claire Grandison.
Everyone who's not charisma, we've got a 1-minute sign and a stop sign. The more time that you leave for questions, the more you get to say. Do you want to hold the baby? You want to introduce her and then I'll take her?
Welcome. Thank you so much for coming to council. We welcome you here. If you could please state your full name for the record and then proceed with your testimony.
Charisma Cooper.
Could you speak into the microphone?
Charisma Cooper.
Thank you. You can proceed with your testimony, Ms. Cooper.
Good afternoon. My name is Charisma Cooper, and my daughter's name is Angel. Thank you for the opportunity to speak here today and share my story. 3 years ago, I was happily with my mom and my siblings. We were all together celebrating holidays and birthdays like a normal family. Then last year, after our family could no longer afford to pay heat, water, and rent, we found ourselves with no food, split apart, and homeless. While my family went to a shelter, my daughter Angel and I basically went from place to place trying to find a stable home. From my aunt's couch to going to OSH each morning to try to get a bed for the night. When Angel and I were on the street, it made me feel shame. I never imagined being in this situation, and I felt the pain of not being able to care for my baby. Most days I cried as I held my child and tried get myself together for her sake. Finally, OSH told me about Covenant House, and that's when I got a glimpse of hope. Even though I found myself in a horrible situation, once I got into Covenant House, that's when things started to change. When I first walked to the doors, I was asked if I wanted a hot meal, but even though I was hungry, I said no. Because I wasn't used to people taking care of me. Over time, I learned to not push people away who want to help me, and I began to see staff as people I can trust. They taught me how to budget, save my money, and maintain a job. But more than all, that they gave me love without strings attached, unconditional love. Last month, I transitioned to Covenant House Rites of Passage program, where I have my own apartment, and I learned how to manage living on my own and how to be the best parent for my baby. While I'm here, I plan to get a head start on my goals. My next step is to get my associate's degree, to work towards my dream, which is to become a pediatrician, helping small children suffer from tumors. Although I had a rough journey, I am much stronger because of it, and I've seen myself stretch to new heights. That's why I'm here today, because I know there are other youth struggling with homelessness, trying to find even a safe place to sleep and food for today. And I hope that me being here and sharing my story will open your eyes to see realities and change and challenges we face every day. I hope that my voice will help other youth speak up and know that we can change the world if we never give up. Thank you. I hope me standing here and telling my story inspires all of you to help us youth stand strong and continue pressing our way through all of this, because it's success at the end of the tunnel.
Thank you so much. Thank you so much, Ms. Cooper. Thank you. Before we introduce the rest of the panel, do you mind if I break protocol? Because we have another youth leader who's here, and I just wanted him to come up in case he had to leave, and that's Mr. Joseph Hill-Coles. Welcome, Mr. Hill-Coles. Good to see you again.
Yes.
If you could just state your name for the record.
I'm Joseph Hill-Coles.
Thank you.
Good afternoon, ladies and gentlemen. My name is Joseph Hill-Coles, and I'm 22 years old. My story is about who I was and who I am today. I was born to a drug-addicted mother in Philadelphia. My dad was never on the scene, and my mom made an attempt to raise me for 3 years while Child Services kept their eyes on her, as they had since I was born. At age 3, my mom was forced to put me up for adoption, but because I was so hard to place, I spent 8 years in more foster homes than I can remember, only staying for a few weeks at a time, passed around, a problem left for caseworkers to figure out, a name on a file, a number. I was someone no one seemed to want. Finally adopted at age 10, by a loving single lady, I had found a home. In spite of good fortune, I was still a very angry child. Anger not only consumed me, it directed my behavior. I was kicked out of numerous schools. I was damaging the relationship with my adopted mom and destroying any opportunity to make something positive out of myself. After a few years, my life began to become as much about leaving home on my own to go and do what I wanted, to being kicked out by my mom because I was running wild. I was a complete mess. At age 18, I was arrested and locked up as an adult for 1.5 years. There I was, a number yet again. Once released, it became all about survival. I house hopped until I wore out my welcome, and then spent a couple of months living on the streets, selling drugs just to be able to have money to eat. I slept in Love Park, in abandoned buildings, and eventually found myself in and out of adult shelters. I'd wonder if any of you here today have ever been to an adult shelter. Let me tell you, it is absolutely no joke. All types of people crammed together in one building, chronic homelessness, drug addicts, people that just got released from prison, folks with serious mental health issues, all piled in one building. 30 men in one shower room, bed bugs, terrible food. One night I woke up and there was a rat on my cot. Now I'm sure those places try to do some good, but it didn't feel that way at the time. I was just another homeless person in the way, just a number, just a body filling a bed. When I first arrived at Covenant House, I was still institutionalized and very street-minded. After being passed around so many times, I didn't think there were going to be anything different. 3 hots and a cot was all I expected, and I allowed myself to get. I didn't trust anyone, I didn't care about the rules, and I tried to do just what I wanted to do. Needless to say, I was in and out of the Covenant House several times, but they never gave up on me, and always welcomed me when I came back. Then one day, something in me changed. I realized in this repeated vicious cycle, I was going nowhere. The streets had nothing to offer to me besides eventually time behind bars again, or a coffin. The people at the Covenant House really did seem to care. I had a home setting again that could provide me with the structure and love I desperately needed. It was clean, it was safe, so different from any of the other shelters I'd been to. I made an active decision at that moment to change. I followed a schedule, I actively searched and found legitimate employment. I learned to think ahead and not just think of now. I decided to trust the staff and build a relationship with them. I was pushed to succeed, and I respect the staff for doing that. Covenant House gave me a firm foundation from which to start again and to help me work to the point that I didn't have to see homelessness as an option anymore. I began to make transformation from who I was for so many years to who I am today, sitting in front of you. During my time at the Covenant House, I moved from the Covenant House shelter to its transitional living program, the Rites of Passage, where I had an apartment but still had the support I needed. I worked first at the Monkey and the Elephant, a great coffee shop that seeks to employ former foster care youth. Isn't that awesome? A business. A business that hasn't forgotten about those of us that were left behind by others. I've also been a mentor at Youth Build Charter School, helping people just like me, and now I work at Urban Tree Connection as a garden educator, an organization that turns vacant lots into community gardens. And a few weeks ago, I moved into my own beautiful apartment at the brand new Francis House of Peace, just a few blocks from here. I was many things before the Covenant House, but I have chosen not to let those things in my past define me. The staff helped to shape me into the man before you today. My commitment, my passion is to give back and to help shape the lives of younger youth so that they don't end up on the streets like I did. I am success, I am a leader, I am wanted, I am supported and cared for, I am loved, I am Joseph. Thank you for the opportunity to be here and give my testimony today.
Thank you so much, Mr. Hill-Coles. Your story's been inspiring, and we are working hard to make sure that that you're not the exception.
And if I might say, Madam Chair, that the fact that he's a caring, giving, a good person comes out even in his voice. We're really, really proud of all that you've become. And in fact, my staff reminds me we toured it, but it's been about 10 years, so I'm trying to recall at this point, remembering what it looked like. We were there many years ago, but God bless you. We're sure you're going to do just fine.
We'd like to welcome Councilwoman Cindy Bass to the hearing, who is also the Chair of Health and Human Services. So, Councilwoman Bass.
Thank you. In a little seat today. But I wanted to also commend you, sir, on your testimony and really bringing so many issues to light and making sure that folks hear you and understand. I wanted to commend you on the way you made a personal decision to go in a different direction to try to change what the probable outcome would have been. And I just wanted to encourage you to continue on your path and keep telling your story. Make sure, we have to keep talking. There's so many issues out here. We have to tell our stories over and over. People will hear you, people will listen, and you certainly know how to deliver it in a way that makes people stop, pause, think, and hopefully take action. So I just really wanted to commend you on being here today, and we thank you. Thank you.
Thank you, Councilwoman. Thank you very much, panel. Please proceed.
Thank you.
Welcome.
Thank you. My name is Shawnee Meacham. I'm the Director of Housing and Emergency Services in Philadelphia for Valley Youth House. I want to thank you for the opportunity to testify on behalf of the young people in Philadelphia who are striving to overcome poverty, housing instability, abuse, neglect, and discrimination. Valley Youth House began in 1973 as a single shelter. We now serve nearly 1,500 young people in Philadelphia per year in 4 short-term housing programs, permanency services, and the lead agency managing the DHS-sponsored Achieving Independence Center. Additionally, Valley Youth House operates a Synergy Project and Street Outreach Program, tasked with reaching over 4,000 youth through outreach activities and providing services and supplies to over 2,000 youth throughout 2016. We work with young people ages 14 to 23 that have been in part of foster care, are lesbian, gay, bisexual, and transgender, who have experienced housing instability and homelessness, and those who have experienced sexual exploitation. These youth are extraordinary, and they move beyond life challenges that average Philadelphians cannot even imagine. Today, you're hearing testimony outlining the crisis facing the homeless youth of Philadelphia. You have listened to youth eloquently and genuinely speak of their experiences. I want to honor those youth who have spoken today and those brave youth who have given us permission to share their stories with you. Although the names may have been changed, the experiences are real. The city's continued support is needed to help reach all the youth that have yet to be seen, and system resources must be increased to meet the need of the staggering numbers you have referenced here today in this hearing. Youth experiencing homelessness are often referred to as the invisible population. They actively seek to avoid shelter and the stigma of being homeless. You've heard Director Hirsch already today discuss the youth counts and our role in them, and I want to specifically note some statistics we've gotten from those counts. On average, an average of 56% of youth surveyed in the Philadelphia youth counts had a DHS placement history. An average of 31% of youth surveyed identified as LGBTQ. These reports indicate that Philadelphia's youth exiting foster care and LGBTQIA youth are experiencing homelessness at a disproportionate rate. Youth in foster care have long been identified as having a greater risk for homelessness upon discharge. These youth represent over 90% of the young people served by Valley Youth House in Philadelphia. As a society, we have come to accept that our children are not transitioning to the full responsibility of adulthood at 21. Typically, youth are living with parents or supported environments on average until the age of 26. Youth exiting foster care, however, this transition is more shocking. They are expected to transition to full independence and suitable housing on or before their 21st birthday, many at the age of 18. Think about a young person in your life between the ages of 18 and 21. Maybe they are your child, sibling, niece, or nephew. Maybe they are in college or studying for a trade. Maybe they stay at home while saving money for the first few months or even years of employment. Imagine all the benefits they may have received by having a stable and supportive home. Now imagine that those supports are gone, or they never existed. Imagine that youth is Sasha, a youth in our supportive housing program who was in foster care since she was 9 years old. While in care, she lived at 6 different placements and attended 9 different schools. She was often left behind academically. Sasha experienced other traumas while in care, including a sexual assault. She was discharged from care at 18 years old with no job or means of income. After a few weeks of house hopping, she was forced to spend her nights at Penn's Landing. For months, she was homeless and alone. She was finally connected to shelter and eventually our supportive housing program only after re-engaging with her coach and the housing liaison at the Achieving Independence Center. It is projected, based off of the needs-based budget plan provided by the Office of Children and Youth and Families, that 841 youth will age out of foster care between July 2015 and June 2016. Of these youth, it is projected only 477 will exit to permanent residence. This is only 57%. Programs like the Valley Youth House Supportive Housing Program and Room and Board Program, with funding by HUD and DHS, help to address some of this need. But as Deputy Commissioner Williams mentioned, the existing programs are not enough to meet the housing needs of the 346 youth that they project will exit the system this year without a permanent residence. Based on current funding, Valley Youth House can only serve 41 youth at any given time, which is just 12% of the overall number projected. Having a safe place to live creates an environment for young people to excel. Almost 90% of the youth in both of those programs exit to permanent residence. They can focus on school, work, and the typical issues affecting youth in Philadelphia. I just want to, I know my time is coming to an end, but I want to note some of the photographs that were attached to my testimony. You'll see them here, and in a tragic irony, one of them in a tent camp found by our Synergy project says, "Dream Homes." Can you imagine identifying academic success in a job if you're living in this type of environment, if you're living in abandoned warehouses, cars, shelters? Without shelter, I apologize. I also want to note that most often youth homelessness also includes house hopping and couch surfing. These are mild sounding terms, but they represent situations that can be very dire. A couch surfing youth is anxiously awaiting the end of the time limit when the goodwill of a friend or a neighbor runs out, and the streets and sadly many of the adult shelters offer dangerous alternatives. A more frightening and very real scenario is that the couch surfing youth is forced into survival sex, trading sex in exchange for a place to stay for the night, or falling victim to the human trafficking trade. The programs that exist for LGBTQ youth, such as Pride, and for foster youth exiting foster care, such as Supportive Housing Program and our Room and Board Program, work, but our funding does not allow us to serve all the youth that have been referred. 40% of youth referred to Pride tonight will not secure housing through the program without increased resources. I want to thank you for your time, and I believe we all share a mutual belief that young people deserve to have an environment where they feel safe and that fosters their transition to becoming a positive contributor to our community. We remain motivated because our goal tonight and every night is to provide access to a safe sleeping situation to any young person who wants one. Thank you.
Thank you. Thank you, Ms. Meacham. Thank you. Hi, good afternoon.
My name is Marianne Bellacerti. Thank you so much for allowing me to testify today. I am the Vice President of Advocacy at Pathways PA. We work each year with 4,500 women, children, and families to help them become self-sufficient. We do that through a variety of programs, but the ones that are most pertinent to this testimony are our Basic Center program, our Center for Families, and our Transitional Living program. I want to talk today about two specific vulnerable populations that we work with, the first of them being girls who have faced human trafficking. Between 2007 and 2015, the National Human Trafficking Resource Center reported over 2,600 calls coming to their hotline referencing Pennsylvania. Unfortunately, trafficking is so highly underreported. We know there are far many more instances of adults and children being victimized for labor and or sex each day. An FBI bulletin from 2011 estimates that nearly 300,000 American youth are currently at risk of becoming victims of commercial sexual exploitation. Philadelphia is one of the top 15 cities in the United States for domestic sex trafficking. Domestic sex trafficking. The most common age for people entering into trafficking is between 12 and 14 years old. Many of the girls that we've worked with have it start with something that seems pretty innocent. Maybe someone coming up and saying they want this girl to be part of a modeling photo shoot. That instance actually resonates with me a lot because when I was talking to some of our staff about it, I suddenly remembered being right out of college and someone coming up to me and offering the same thing. I'm wondering now what would have happened if I had gone ahead with that. So to know it's still happening is pretty shocking. Over the years, we worked with a lot of clients who have said, yes, they participated in this type of thing. And while they don't want to talk about what happened at those photo shoots, we know that nationally, a lot of this type of unsolicited thing ends up as something far worse. We do see victims of trafficking at Pathways PA. I can't get into a lot of the details, although I did include in my testimony a poem from one of the victims, but I'd be happy to meet with any of the council members individually to talk about it further. We just want to protect their privacy. In addition to working with young women who have survived trafficking, we also work to prevent very young women from becoming involved in trafficking by providing a safe and temporary place for them to live. At our Basic Center program, we work with girls ages 13 to 17 who are homeless or who have run away. We know that girls who have run away or have been kicked out or abandoned are disproportionately more likely than other girls to have sex prior to age 13. More than 1 in 5 runaway and homeless teen girls who have been kicked out, run away, or abandoned have gotten pregnant at least once. At the Basic Center program, we have 5 clients aged 13 to 17 years old at any one time. They can only stay with us for 21 days. And during that time, we work with them to assess their health, re-engage them in school, and reunite them with a safe and supportive family member. It's not necessarily their parents who we reunite them with. Because of their age, any girls who cannot be reunited with family have to be referred to DHS at the end of their time with us. But since January, we've been able to reunite all but 1 youth during that 21-day period. In recent months, a lot of the girls who are coming to us are having problems with their caregivers or their guardians. They've ended up living with their friends, with extended family, couch surfing, even living with teachers or coaches. We had one girl who came to us because she was no longer getting along with her foster mother. And so she spent 2 weeks with a friend. She went to a sister. She continued to house hop until finally she had no other choice but to go to DHS. And now she's at our Basic Center. With this population, we're finding that not only do the girls need help, but so do their caregivers. A lot of the time, the girls are coming in with problems that are not that far out of the normal teenage realm, but the caregivers just aren't able to deal with it. So what we are doing as much as we can is getting involved early so that we can help the entire family. And we definitely recommend help not just for the teens, but also for their family members so that they can stay in a safe household for longer. Thank you.
Thanks for all your work, Ms. Bellasort. Thank you. Good afternoon.
Hi, good afternoon, and thank you for the opportunity to speak here today. My name is Kate Gormley, and I'm a licensed social worker from the Mazzoni Center. The Mazzoni Center is a Philadelphia-based nonprofit which was established in 1979 and serves the health and wellness needs of the gay, lesbian, bisexual, and transgender communities. In fiscal year 2015, we impacted over 35,000 individuals, including nearly 4,000 youth and young adults. We are the oldest HIV serving agency in the state and the 4th oldest in the country. Today, I'd like to talk specifically about the unique needs of gay and lesbian, bisexual, transgender, and questioning youth, and the risk factors associated with being queer or trans as related to youth homelessness. While LGBTQ individuals and issues have become commonplace discussions in many households and within the halls of government, we face immense challenges in terms of caring for and improving outcomes for our gay, lesbian, bisexual youth, and especially our transgender young adults. LGBTQ youth are more likely to experience family rejection from family members and harassment and violence in the schools than their heterosexual and cisgender peers. Numerous studies have outlined that the most common reason for LGBTQ youth being kicked out of the home is, in fact, family rejection. In 2009, the National School Climate Survey published the results of a nationwide study of middle and high school-aged youth, found that LGBTQ youth were 61% more likely to report feeling unsafe in the school environment than their heterosexual and cisgender peers. Lesbian, gay, and bisexual youth are also 4 times more likely than their heterosexual peers to attempt suicide, Additionally, nearly half of trans youth reported having considered suicide, with 25% of these youth had made previous attempts on their lives. As a result, many LGBTQ youth are pushed out of the home at an early age or forced to leave violent and abusive environments and seek shelter away from their families. The 2012 study entitled Serving Our Youth reported that while nationally, LGBTQ youth account for an estimated 10% of the total young adult population, they represent a whopping 40 to 50% of the homeless youth population. Research has demonstrated that once LGBTQ youth find themselves homeless, they're at far greater risk of future victimization. The National Alliance to End Homelessness reported that once LGBTQ youth are homeless, they experience an average of 7.4 more acts of sexual violence towards them than their heterosexual peers. These statistics speak to the vulnerable nature of this invisible population and the many barriers and challenges LGBTQ youth may face while seeking services and housing. It is very important that we understand that the LGBTQ umbrella represents many communities and many experiences. I'd like to talk briefly about the specific needs and barriers facing the transgender community as they relate to accessing housing. A 2010 survey by the Center for American Progress clearly exemplifies this point by reporting that transgender youth first experience housing instability on average by the age of 13 years old. This is an entire year earlier than their gay, lesbian, and bisexual peers. Can you imagine being homeless at 13 years old? For the transgender community, these dismal statistics are only the beginning. The National Transgender Discrimination Survey found that transgender individuals are twice as likely to be unemployed as a result of discrimination in the workplace and are 4 times more likely to live on less than $10,000 a year. The unique stressors and repeated trauma experienced by many queer and trans youth, when coupled with discrimination and harassment in the community, place these teens at a far higher risk for depression, substance use, and long-term negative health outcomes. As the City of Philadelphia works to increase supports available to homeless youth, it is imperative that we keep the voices of LGBTQ youth central to this conversation. Philadelphia is home to a thriving LGBTQ community, but far more resources are required to serve our more vulnerable populations. We owe our youth greater access to a future rich in educational, employment, and housing opportunities, and the first steps toward this future is increasing access to affordable, safe, and affirming housing options for youth. Thank you for your time.
Thank you so much, Ms. Gorman. Good afternoon.
Good afternoon. My name is Claire Grandison, and I'm an Independence Fellow and Staff Attorney at Community Legal Services, where I also co-lead our new Youth Justice Project. Community Legal Services is the largest provider of free legal services in the city of Philadelphia. And our newly formed Youth Justice Project seeks to provide holistic and age-appropriate legal services to youth ages 16 through 24 who are making the transition to adulthood in the face of significant challenges, including homelessness. Based on the areas of our work, CLS's Youth Justice Project is primarily concerned with 3 populations, which is what I will address today: youth with justice system involvement, youth with disabilities, and young parents. First, consider Youth Justice Project client Rose, who at age 22 could not find a job because of her criminal record and could no longer afford to pay her rent. Rose had been struggling with drug addiction and was given entry into a diversion program for first-time drug offenders, but she could not afford to pay the associated fines and costs necessary to complete the program and get her record expunged. She and her 2 very young children became homeless. DHS got involved, and her children were removed from her care until she could find a stable place to live. It's National Reentry Week this week, so it's a good time to recognize that barriers to employment and housing must be removed to increase available income, ensure housing stability, and stop punishing youth indefinitely for things that happened in the past. Youth of color are particularly likely to be arrested, convicted, and incarcerated. Employers and housing providers alike often have policies that categorically exclude young people with juvenile and criminal records, despite guidance from the Equal Employment Opportunity Commission and the Department of Housing and Urban Development, stating that such blanket exclusions are likely to produce a disparate racial impact and violate civil rights laws. The second group of concern is youth with disabilities. Take youth justice client Mariana, who came to CLS after losing her Medicaid and her SSI disability benefits, which had been her only source of income. She had bipolar disorder, but was not able to fill her prescriptions. She was not able to see her psychiatrist or her therapist without insurance. She moved among friends' houses and a shelter because without treatment, it was difficult for her to avoid conflicts. The Youth Justice Project got her both Medicaid and continuing SSI benefits while she waits the 2 years that it currently takes to get a hearing and a decision in an SSI appeal. In Pennsylvania, 3 out of 14 recipients of SSI lose their disability benefits when they turn 18, just like Mariana, and many are left with no income. Youth with disabilities are employed at half the rate of those without disabilities and thus face greater challenges securing other sources of income. The final group I will address is young parents who often face homelessness due to lack of family support networks, lack of affordable childcare, which is necessary for young parents to be able to work. And while cash assistance may provide a modest source of income to young parents, they are unlikely to be able to afford housing without some additional help. When young parents and their children are thrust into homelessness, they are often forced to separate based solely on a shortage of parent-child shelter beds, foster homes, or other placements. Lack of resources should never be a reason for separation, which is highly stressful, traumatic, and damaging to child development. The Youth Justice Project fully supports more shelter placements for youth when they become homeless, especially placements that take into account the need for young parents to remain with their children. The Youth Justice Project also recognizes that future homelessness can be prevented by ensuring access to legal representation in areas such as eviction prevention, public benefits, and expungements by providing holistic and wraparound supports. Thank you for the opportunity to offer remarks on this important issue.
Thank you so much for your testimony. We'd like to thank you very much for your testimony and especially for all the services that you provide. A number of you have been around in a couple of tables. We'll be following up, especially around a number of the issues that you've raised. I did have one quick question for the attic, which is that youth who experience all this trauma in foster care in particular, whether there's ever been any discussion with DHS about having some kind of an emergency call line or anything like that for young people. Like I know that it's traumatic for a lot of young people. I'm sure LGBT youth aren't the only ones who suffer from feeling that, but given the kind of prevalence that we're hearing on a repeated basis, has that ever been discussed, or are there thoughts about how to handle that level of harassment when it's dealing with a foster care parent in particular?
Not to my knowledge. I work at the Mazzoni Center.
Oh, I'm sorry.
No, it's okay. I don't know
Apologies.
if the attic has had any conversations with DHS. I think that would be a wonderful idea and a great place to collaborate to help bring these issues to the providers in a more positive way than they're sometimes dealt with.
Yes, thank you so much, Ms. Gormley. So thank you, and we'll just continue the conversations. Thank you very much for your work. Could the clerk please call the final panel?
Panel 4, Alex Dutton, Jenny Pokempner, and John Dukoff.
Welcome. Thank you so much for your patience. We appreciate it. And if you could just state your name for the record and then proceed with your testimony.
Sure. Good afternoon. My name is Alex Dutton. I'm an Independence Foundation Public Interest Law Fellow and attorney at the Education Law Center. I thank Councilwoman Gim and Councilman Dom for this opportunity to give remarks on this important topic.
Mr. Dutton, could you just place your microphone a little closer?
Sure.
Thank you.
ELC is a statewide public interest law firm dedicated to ensuring that all of Pennsylvania's public school students, and especially its most vulnerable and educationally at risk, have access to a quality public education. And as a part of this mission, we advocate on behalf of homeless and unaccompanied youth to ensure that they have equal access to quality public schools. I want to talk to you a little bit about the rights that homeless students have in public schools. The homeless youth have certain rights and protections in schools pursuant to the McKinney-Vento federal law. And the definition of homeless children and youth under that law includes individuals who lack a fixed, regular, and adequate nighttime residence. And this also includes those youth who are sharing the housing of other persons due to loss of housing, economic hardship, and other similar reasons. The law also defines unaccompanied youth as a youth who is not in the physical custody of a parent or guardian. The distinction between this definition is important in terms of our identification of those unaccompanied homeless youth who may or not be coming to the surface to our school districts. Key rights that the law provides are maintenance in the student's school of origin. So when a highly mobile youth is moving from school to school, they have the right to remain in the school in which they're staying in order to ensure school stability, even despite their housing instability or mobility. Another key right that the law provides is an immediate enrollment in another school, even if that youth does not have the required documents under Pennsylvania law or state law to enroll, and that includes proof of age, residency, and immunizations, another measure to ensure the school stability of our highly mobile youth. And in addition, the law provides the appointment of McKinney-Vento liaison at every local educational agency to ensure that homeless students are identified and are maintaining school stability, and as well as being afforded access to the same educational opportunities that their peers and non-homeless peers are afforded. And that includes re-engagement and learning opportunities, remedial and supplemental instruction, school supplies, SAT prep, and the like. So in terms of issues and policy recommendations, we must proactively identify unaccompanied homeless youth, in addition to homeless children and youth, through interagency collaborations that ensure that the school district provides these needed services. In the 2013-14 school year, the School District of Philadelphia identified about 4,300 homeless children and youth, but only 45 of those youth identified as unaccompanied. This suggests that there's a disparity between homeless youth and unaccompanied homeless youth, and an under-identification of those who are unaccompanied, who are often our older youth, who are often stigmatized by their homeless status and are not coming forward and are unaware of their rights under the McKinney-Vento law to quality and equal public education. And these students face barriers to enrollment, as I suggested, because they do not have access to families who have the documents that they need to enroll. So it's important to identify them so that our school district's McKinney-Vento liaison can ensure that they enroll in school promptly and maintain constant enrollment in school despite mobility outside in their home life. So we need to destigmatize this so that youth can self-identify. This includes perhaps creating a confidential call line, but it also includes training our staff and administrators, teachers at schools to understand the signs of homelessness and understand the definition of homelessness under the McKinney-Vento law, so that these youth are identified and provided the services to which they're entitled. In addition, this requires interagency collaboration so that our youth-serving organizations and departments in the other areas in the housing world and in the child welfare world are referring these students to the McKinney-Vento liaisons at the school district so that they're receiving the supports that they need. Secondly, we must improve academic achievement through access to services and opportunities. We know that a high rate of mobility certainly decreases, is one of the largest impediments to academic progress, and decreases the chance of graduation by the time a child turns 25. So that's another important area. We must ensure that our school district is funded properly and to ensure to provide all of these services and to students who are experiencing homelessness. One thing I want to mention here is that it's really important to provide the full range of challenging academic curriculum to homeless students as it is to our non-homeless students, despite the challenges that homeless students face. And finally, I think that the last issue is credit recovery and graduation planning for our highly mobile youth. And so what this means is that the U.S. Department of Education has cited credit recall as one of the largest impediments and barriers facing students experiencing homelessness as they attempt to resume their educations. So as a result, we must implement policies and adopt practices that ensure access for our homeless students to credit recovery programs that provide the flexibility that these students need to maintain stability in their educations. At the same time, we must maintain quality and opportunities to challenging curriculum and not just place these students in accelerated programs or online programs that don't provide them the equal access to the school curriculum that their students are achieving as well. And finally, we need to ensure that our schools are providing graduation plans for these students that are flexible to their needs. And so that may include graduation pursuant to state standards as opposed to local educational agency standards. So students who are highly mobile may have taken a course at one high school that's not actually a course required for graduation at another high school, and end up being over-credited and not being able to graduate pursuant to the local high school requirements. And that's an important piece of this too, to ensure that graduation planning is individualized so that those students can leave school with a diploma and enter the workforce as productive citizens. So thank you, council members, for this opportunity to speak about the impact of homelessness on education and students in school, and I appreciate the opportunity. Thank you.
Thank you very much, Mr. Dutton. Welcome.
Good afternoon. My name is Jenny Pokempner. I work at the Juvenile Law Center. We are a legal advocacy organization in its 41st year in Philadelphia. We work on behalf of older youth in the child welfare and juvenile justice system. We also have 2 youth engagement programs, Youth Fostering Change and Juveniles for Justice. Labria Morgan is one of our alumni leaders. Today you've heard a lot from youth and from advocates about the nature of the problem of youth and young adult homelessness. You've heard that youth in the child welfare system are at extremely high risks of aging out, and that's very accurate. Also want to add that youth leaving the juvenile justice system are also at extremely, maybe even higher risk than youth aging out of the foster care system. And I want to address some recommendations related to those 2 groups. Because I think the opportunity we have is that while it's extremely disturbing that youth that are our responsibility and actually in our state's care that we removed because of abuse and neglect are at such high risk, it does mean that we have this extraordinary opportunity to do a positive intervention. We know exactly where these youth are, and we know a lot about them. We know what their needs are. We need to know more, but we know a lot about who these youth are and what's happening to them, who has behavioral health needs, what risks that poses to them aging out. So we have this opportunity that we need to take advantage of, and if we do, we can make a big dent in the young adult, homeless youth, homeless young adult population. So I think that's something that at least is something that we need to take advantage of. Our full recommendations are in the testimony I submitted. I just want to highlight a couple that might address some of the issues that have been raised throughout the hearing. First, the best way to address youth aging out of these both systems to homelessness is by preventing them from aging out altogether. So by placing them, reunifying them with family, and finding other family resources and investing more in that is something we can do, because we know that if youth are with their families and their families are well supported, that's the best way to help them through the transition to adulthood. We know that from our own transition, and you know that from your kids' transition and how much they rely on you as they're transitioning. So we really do need to put more investment in reunification services at DHS for both dependent and delinquent youth. And we need to understand that working with families to support older youth looks different and requires different expertise than reunifying an infant with a parent, for example. And we also need to support when those parents can't care for those children, supporting their relatives. And we need to focus, and having heard from so many youth, not just identifying family and placing them, but supporting the family to maintain it stably, so that the youth is not returned home and then in 2 weeks is kicked out or ends up in a shelter. So really committing to these families and knowing that if we do, we will see the result, because that being attached to family we know is one of the best protective factors in that transition. We also need to address that if youth can't be returned or placed with family, that the core function of child welfare is to find them family. And that means adoption, guardianship, and other resources if they cannot return home. And again, we need to focus on that, recruiting resources for young adults, for adolescents. And as people have said, and Labria said this very well, we need people who want to work with teenagers and know that that's a skill and will be supported in that, because it is different. And again, I know all of us don't like to admit that we were difficult as teenagers, but most of us were. And our parents had to have patience, and they had to have skill, and they also had to have a support system when things got difficult. So we need to invest in recruiting families, foster families for youth in foster care, and as many of the panelists have said, families that want to work with teenagers but also are willing to support LGBTQ youth, parenting youth, and youth with behavioral health needs. Because again, we know those are our highest risk youth, even in the child welfare system and juvenile justice system, for aging out. And we've seen other jurisdictions do that and do that well. So we do have examples of that. I think DHS is starting to do that, but we really need to put our money where our mouth is, both in saying that we want quality care and we want to support it. We also make some very specific recommendations about the structures that can be put in place in DHS, both in terms of creating an adolescent services unit that can really focus on policy development, but also overseeing cases and monitoring. There needs to be more accountability in transition and discharge planning, and the buck needs to stop with the agency being responsible. Right now, if youth age out to homelessness, only the youth pays for that. There's no accountability back to say to the system, you messed up. You need to do more. It's the youth that pays. We need to make sure that there is accountability, but I will also clearly say we need to equip DHS with the resources to do this well and acknowledge that it's a really hard task. So we need to, in addition to having, I think, a very specific transition planning type of unit, adolescent services unit, that we need to have clear protocols for discharge planning and transition planning so that it's clear what is expected and that it is clear that we prohibit discharging youth to homelessness. And if a youth is about to discharge and they're going to homelessness, the answer is you're going to have to do more. Not too bad, you're too old, that we say our systems are going to provide services. Finally, I know my time is up. The last recommendation is just as reiterating what people said. For those youth that do age out because we didn't find them families, and honestly, when we do that, we failed them, we need to provide the housing support after they leave, because they deserve that. We have to think about what kids between 18 and 26, how they live. And they live with a lot of supports, and we know that when we provide them that again, we are really impacting the trajectory of their life. We know from the brain development and the choices we're making, if we can help them focus on education, give them the time to get education and skills, we will be making an investment that will yield such results in terms of youth who will be able to pursue their careers. We saw that today when we invested in Bria, when we invested in James. Joseph, I'm so sorry. And Joseph, we are seeing young people who are going to benefit the city, who are going to not just benefit in their careers, but they're going to give back. And we will benefit not just in money, but just in doing the right thing. Thank you.
Thank you. My staff tells me exactly what you say, that you're really on point, and you all really are saying it as they see it. Thank you for all you're doing.
Thank you. Hi. Welcome, Mr. Dukoff.
Thank you. Good afternoon. My name is John Dukoff, and I'm the Executive Director of Covenant House, Pennsylvania. At the outset, I'd like to thank Councilwoman Gim, Councilman Dom, and the entire committee and council for your leadership on this incredibly important issue. As we've heard today, homeless youth are an invisible population, largely overlooked, forgotten, and ignored. I'm here today to say that that is a mistake. These young people are an opportunity And the mistake of ignoring them certainly is a mistake that harms these young people, but it's also a mistake that harms our city, because if we as a city step up now, these young people will become like Joseph, like Charisma, like Librea, the next generation of Philadelphia's entrepreneurs and artists, lawyers and doctors, social workers and nurses. If we don't step up now, as our young people often say, they'll become the next generation of chronically homeless adults, in jail, or dead. It's our choice. At Covenant House, we work exclusively with homeless youth. This is what we do. This is all we do. We serve homeless youth in 27 locations in 6 countries. We served 51,000 homeless young people last year, including 2,500 in Philadelphia alone. We do street outreach where we find young people on the street. They can come into our 24/7, 365 emergency housing program and receive a full array of services from behavioral health, mental health, substance abuse, education, vocation, case management. And when they leave that program, they can go to our Rites of Passage transitional housing program where they can live for up to 18 months while they work, and we teach them how to live independently. They pay rent, they get that money back at the end, so they can leave us with $8,000, $9,000, $10,000 saved for a first and last on an apartment. But the core of our work really is this. We become family for our young people. As Jenny just said so eloquently, family is what these kids need. And we become family for young people. That's what our kids say. Covenant House is my family. And we all know that family lifts us up. And if we can lift these kids up with family, they can truly transform their lives and achieve and ascend to their full potential. Last year, our emergency housing program, our 24/7, 365 emergency housing program, served 512 homeless young people. We turned away 546 more because our house was full. These 546 young people and the hundreds and thousands like them are our kids. The young people we serve sit right at the intersection of 2 city agencies, the Department of Human Services, which is charged with addressing abuse and neglect, and the Office of Supportive Housing, which is charged with addressing homelessness. Now, our young people, in many, many cases, are homeless because of abuse and neglect, because they've been pushed out, because they've been thrown away. In fact, 40% of the young people we serve at our emergency housing program had a foster care involvement. So 40% of the young people we serve, 2 out of every 5, were at some point in their lives in the custody of the Department of Human Services, and yet they ended up homeless and at our doorstep. And the 60% of our youth who weren't in the custody of the Department of Human Services, they very well could have been. These are the same young people facing the same issues, the same abuse, the same neglect, the same trauma. These young people, the 512 we served and the 546 we turned away, these are DHS's kids. Now, to its great credit, the Office of Supportive Housing has made real progress. It's functionally ended veteran homelessness and made real progress toward ending chronic adult homelessness, building thousands and thousands of units to serve this very deserving population. But unfortunately, the Office of Supportive Housing has made very little progress toward ending youth homelessness. There are only, by my count, based on the 2014 OSH Continuum of Care, 70 on theirs, 6 that I know about, 76 emergency housing beds specifically designed to serve teenagers and adolescents in the entire city of Philadelphia. 76 in the 5th biggest city in the United States with the highest rate of poverty, 76. OSH counts those beds in its continuum, but funds none of them. In fact, 51 of those 76 are at Covenant House, and they are 100% funded by private philanthropy. OSH, well-intentioned, but did not contribute to help the 512 youth we served last year, and did not contribute to help the 546 youth we turned away. These youth are OSH's kids. Today, we respectfully recommend 2 solutions. First, the mayor's office should create an interagency council, a task force charged by the mayor with the sole goal of ending youth homelessness, developing a plan to that end. But a plan is great. A plan is great, but we can't wait for a plan. So we need a plan. We need a plan with all involved stakeholders, all involved agencies, non-government advocates. We need a plan that's transparent, that's robust, that's resourced, that's smart, that's thoughtful, and that we execute rigorously. But we can't wait for that plan. A few months ago, I was standing by our front door, and a young woman walked in, and I said, "Can I help you?" And she looked at me, and tears started to roll down her cheeks, and she said, "I'm 18 years old, I'm 8 months pregnant, and I don't have a place to stay." And so I brought her in to our cafeteria, and I gave her a sandwich and a drink, and we talked for a few minutes, and I told her that we couldn't help her because we were full. We had that conversation 546 times last year. And most likely, one of my coworkers is going to have that conversation again today, twice. We believe that the city needs to immediately significantly expand the number of emergency housing beds for youth. Now, we stand ready to do our part. I have a list of those 546 kids. I have their cell phone numbers. If we had the resources, we'd start building tomorrow. And I can commit that as we sit here today, within 100 days, we would build capacity to serve 180 additional youth. Now, that's a great start, but it's not enough. We need to more than double to address our turnaways issue, to serve those 546 kids. And if that's what we need to do, we will at Covenant House, and I hope we will as a city, because these are DHS's kids, these are OSH's kids, these are our kids, these are the City of Philadelphia's kids. We're here today because we stand ready to work with council and the administration to help these kids. We're here today because we stand with a community of people, many of whom you've seen here today, who care about these kids, and we're here today because we stand with the 546. Thank you for the opportunity to be here today. I would welcome any questions.
Thank you. Thank you all very much for your testimony. I want to thank Councilman Al Taubenberger, who also joined us today. Councilman Dom?
Thank you, Madam Chairwoman. I like saying that. Anyway, I have a question for Covenant House. You say in your testimony 51 of the 76 beds at Covenant House are funded 100% by private philanthropy.
Yes. Yes, that's correct.
Okay. And you say you could service another 546. What is the cost per bed, roughly?
The cost per bed roughly is about $27,000, $28,000. We estimate that we could solve our turnaways issue, $2.4 million annually.
Well, 2.4 million is not 28,000 per bed.
Well, if to solve our problem, we'd have to build about another 75 beds, we estimate. So the cost to do 75 beds is we projected about $2.4 million annually.
So help me through this. 75 beds, but you turned away 546 people. That's because they're not coming at the same time.
They're not coming at the same time, and they stay on average about 30 days. This program is not designed to be a place where people stay forever. It's designed to kind of get kids in, pick them up, give them the skills they need, come up with a plan, and move them on to more permanent housing options like our transitional housing program.
All right, so we heard earlier testimony from the city, I believe, that said they needed $3.5 million for 380 to 400. But you're saying for 75, it's 2.4.
So the $3.5 million includes, and I was one of the agencies that submitted that. There were 4 of us that provided, that said, if you basically it was, if you had $1 million, what would you do? And one of the things that we said was we would immediately add another 20 beds. We've now, rather than parse it out, we just looked at it all in and said, what would it cost to solve the turnaways problem, our 546? And that's the $2.4 million annually.
And have you ever thought about the private philanthropy? Are those local foundations?
So it's foundations, it's individual donors, it's event-driven. We basically, we're 99.9% privately funded, so that we get a little public funding just for our street outreach program and not for any of our beds. And we leverage private fund. I mean, we're 99.9% privately funded, so that's what we do.
That 2.4 million, is that an annual cost, or
yes,
that's every year?
Every year.
How do you go about building out for 75 more beds? Isn't there initial upfront cost?
Yes, so that doesn't include any of the capital costs. We'd have to figure out, we'd have to find a building, we'd have to figure out capital costs. There are funding streams we could tap into for that, and that's what we would do. This is just the operating cost, the cost of staff and provide the services.
So are you capable of having the capital costs and just concerned about the operating? Do you have the capital costs taken care of?
We don't have it taken care of, but we would, if we had the operating costs, we would absolutely commit to it. We're investigating a capital campaign now, but we want to talk to our partners. We've done some planning on this. We want to be in a position that we can move forward to identify the operating funding and that we can move forward to identify the capital costs. We're talking to the right people, we're looking at the right funding sources, and we're building a plan.
So I'm trying to understand something. 75 beds cost $2.4 million, which is almost 30,000.
Yeah, somewhere between 25 and 30.
Why is it so much money?
It's to Jenny's point. These kids are kids, they're teenagers, and so they need to provide them, as Jenny said, and she's right, and even as Director Hirsch said, these kids, because they're adolescents, because they're teenagers, much more staffing and supervision and services, wraparound services that they need. It's a much more intensive intervention. You heard Joseph, a young man who lived with us, describe his experience in the adult shelter system, and he came to Covenant House and kind of thought it would be 3 hots and a cot. 3 hots and a cot would be cheaper, no doubt, but 3 hots and a cot is not what we provide.
Right. Okay. Thank you very much. Thank you.
Absolutely.
Thank you. The chair recognizes Councilman Taubenberger.
Thank you, Madam Chair. One question on what you had said earlier, that tonight probably your agency will turn someone away. They've done it because they're full.
Absolutely.
Where do they go?
Well, this is the challenge. The only place we can refer them is the adult shelter system. And our kids won't go there. You heard Joseph describe his experience, so I don't need to repeat that, and I couldn't say it anywhere near as eloquently. Our kids, they're teenagers, they're adolescents. They care about how they're perceived, and they're scared. They don't want to engage in that system. So what happens is these kids end up, maybe on the street, right? Maybe in Love Park. They end up riding the 23 bus end to end. They end up on the subway end to end. All night coffee shops. Big one, abandoned houses. Our young people call them abandos or abandominiums, which is frightening in its kind of gallows humor. But that's where they end up. They end up couch surfing, so they're trying to find friend to friend to friend. If they've come to us, they've run out of friends. But those are the core places. We have there are a lot of abandoned houses around the city of Philadelphia, and that's a big place.
And if you have room to accommodate them, I think I heard you say this, but how long are they then with you normally?
At our program, the average is kind of around 30 to 60 days. We have some young people who stay much longer. I talked to a young woman today who's been with us a year. And we have some young people who are shorter because, again, as Jenny said, and her experience is exactly right, we have young people who walk in the doors and say, because we're about being a place that's welcoming and supportive, but we're also about rules and expectations, right? You can't just come in and lay on the sofa and watch TV. So we have young people who will come in and say, whoa, all these rules, I'm out. But then our hope is we've been welcoming enough that they come back. And so we have, and you heard Joseph say this as well, they will come back time and time again until they finally make that choice that he made.
One last question. If they do come back, do you accommodate them, or does it depend?
If we can, if we've got the space, absolutely. Okay. Our goal is to be there for our kids every time with open arms.
Okay. Thank you very much.
Absolutely. Thank you.
Thank you very much.
Thank you.
The chair recognizes Councilman Dom.
Thank you. One other thought, just as an idea. You know Cristo Rey, the school, Cristo Rey? Okay. They have a great program where they have their kids work in a job. Is there some way to match, I heard Joseph speak earlier about that, match companies with our homeless kids and get them jobs in those companies?
It's a fantastic idea. We do have an education and vocation department that will connect kids with jobs, and we've been doing some outreach. In fact, some of our young people, we've built some of those relationships. We need to do more. And honestly, I look at these kids, I say when I meet with CEOs or when I meet with business people, which we've started doing within the last year, I say, look, if I've got a kid who pulled himself out of homelessness at age 18, this kid can do whatever job you have. There's a grit and determination that's powerful.
After this meeting or in the next coming weeks, I'd like to meet with you about that. I think you can expand that program.
Love to. That would be terrific, Councilman. Thank you.
Thank you very much. I have a million questions actually for Juvenile Justice and Law Center, but I'm going to withhold them because I think we can follow up afterwards. But I do want to thank you all for your work. I want to thank everybody in the audience for their patience and for their passion about this issue of youth experiencing homelessness. We also invite you on behalf of council to join us on the northeast corner of City Hall just outside. There is a Couches Don't Count campaign that is being sponsored by Covenant House and Valley Youth House to raise attention to the fact that youth who couch surf aren't living in a real stable home, and what we are trying to do is raise attention to that. So if we could bring some of us to join members of us on council, Councilman Taubenberger, Councilman Dom, and Councilwoman Blackwell, that would be wonderful, and we invite everybody here. And seeing as there are no more witnesses, this concludes the business of the Joint Committee on Children and Youth and Housing. The public hearing on resolution number 1600 160235 is recessed to the call of the chair. And we thank you all very much for your attendance. Thank you.
Thank you. Thank you.